Good morning, honorable guests, ladies and gentlemen. Welcome to the ITTP-COVID19 Policy Group discussion hosted by University Technology Malaysia and Universitas Indonesia. I would like to kindly remind everyone to fill up attendance by answering through the links provided in the chat box. Here are some of the code of conducts that shall be followed by the webinar attendees. Only registered participants can participate in this webinar. Those who haven't registered need to do so by filling up the registration link provided in the chat box. Participants are entitled to a certificate if the survey link has been answered. So, if you haven't answered the survey link posted yesterday, please fill up the survey link provided at the chat box. Virtual certificates will be given to the entitled participants no later than 7 working days after the webinar is completed. No official rest throughout the event. However, you may take your own rest time accordingly, and you do not need to inform anyone. Please rename yourself as such institution _ title _ your name. For example, UTM _ Miss Emily _ or PSU _ Prof _ Kun. Question can be asked in the chat menu in Zoom with arrangements. Institutions _ first name _ the questions. Only selected questions will be asked during the live sessions. The policy group discussions will be conducted in such manner: 20 minutes presentations by the speaker, 30 minutes discussions handled by the moderator, 10 minutes survey presentations by the presenter. The participants can use the raise hand button. The moderator will unmute the selected person during the discussions. The moderator will select the question based on the expertise within the limited time of discussions. The material will be shared in the ITTP-COVID19 webinar website. All of the attendees are required to fill up the registration link and answer the survey link. The links are provided in the chat box. We will begin shortly at 8:50, and then we will begin for our first speaker at 9 o'clock sharp. Thank you.
Thailand has reported the first case of the Wuhan coronavirus found outside of China.
Well, the Philippines' second quarter GDP is a sobering reminder of the economic destruction brought about by the pandemic. Many other Asian countries also reported economic contraction due to the lockdown.
All hospitals in Java Island is already reached their maximum capacity in treating the patient, and also the daily date case also break the record 1,000 a day.
Proof of vaccination and international travel. So should a requirement of proof of COVID-19 vaccination for international travelers be introduced in the future, then the recording of the proof of vaccination should be based on the 4 key design principles of equitability, accessibility, scalability, flexibility, and sustainability, as well as privacy protecting.
SMEs are able to become more productive, and at the same time they're able to overcome some of the constraints due to their limited experience and limited scale.
For me, teaching in this new paradigm remind me again and again of the importance, but of the sincerity of care, of deep listening, of communication. And all of this I've learned to realize that, all of these need to be enacted upon and need to be followed through from all levels, from the management teams to our colleagues, to support staff and our students. We cannot do all this by ourselves.
Basically, we need to focus on adherence to the health protocol, cleanliness, health, safety, environmental sustainability. We need to make sure that the new trend of tourism of normalized, customized, localized, and smaller in size will be basically
Good morning, honorable guests, ladies and gentlemen. Welcome to the ITTP-COVID19 policy group discussions hosted by University Technology Malaysia and Universitas Indonesia. I'm Yoong, your Master of Ceremony for today's event. On behalf of the host, I would like to extend our most tremendous appreciations to each and every one of you for being able to attend this event. Honorable guests, ladies and gentlemen, 27 leading universities in Southeast Asia have come together with the support from the ASEAN University Network Secretariat, the Executive Office of the President of the Republic of Indonesia, other government agencies and industries to establish a joint initiative to recover from the COVID-19 pandemic together, which is now known as the ITTP-COVID19. It is a 3-year planned initiative that includes several international programs such as conferences, webinars, innovations competitions, and joint research. This initiative aims to build a common platform for exchanging ideas and insights on the COVID-19 pandemic based on research and experiences, formulate policy recommendations, and identify relevant technologies to support COVID-19 response and recovery plans. With that, University Technology Malaysia and Universitas Indonesia are very honored to be the hosts for this meaningful conference. Here is a rundown for today's event. Each topic will be followed by a 20-minute speech by the speaker, 30 minutes discussions handled by the moderator, and 10 minutes survey result presentations handled by the presenter. Honorable guests, ladies and gentlemen, after the turbulence of the pandemic that halts for all the traveling across the world, we need something to enable us to travel again. It is a great start with our first topic of the discussions today, final discussions on ASEAN Smart Mobile Certificate. Before that, please allow me to introduce you the presenter, moderator, and speaker for topic 1. The presenter for this session is Associate Professor Dr. Rafee Baharudin. He is currently the Director of Occupational Safety and Health, University Putra Malaysia, and a Senior Lecturer at Faculty of Medicine and Health Science, University Putra Malaysia. He holds a PhD in Environmental Science from University Kebangsaan Malaysia, with experience as a committee member of Malaysia's Industrial Safety and Health Association. He also has teaching experience in environmental health and assessments of exposures and health risk. These sessions will be moderated by Professor Sanjay Rampal. He is the Professor of Epidemiology and Public Health Medical Specialist at University of Malaya. He is the Chairman in Public Health Society with Malaysia's Medical Association. He holds a PhD in Epidemiology from Johns Hopkins Bloomberg School of Public Health and experience related to the topic as a professor in disciplines of epidemiology and biostatistics from the Department of Social and Preventive Medicines, Faculty of Medicine, University of Malaya. Furthermore, he is also a member of COVID-19's Epidemiological Analysis and Strategy Task Force in Ministry of Science, Technology and Innovations, Malaysia. Now, I would like to introduce you our speaker for this sessions, Dr. Auliya Suwantika. He is a member of Health Economics Working Group, Indonesia's Technical Advisory Group on Immunizations. He holds a PhD in Pharmacoeconomics, Pharmaceutical Economics from University of Groningen. With experience related to the topic as a member of Health Economics Working Group, Indonesia's Technical Advisory Groups on Immunizations. Let us welcome Dr. Auliya for his insightful sharings. Dr. Auliya, the floor is yours.
Okay, thank you very much, MC, for the introduction. Good morning, ladies and gentlemen. Yeah, so at this occasion, I would like to share my presentation entitled Asian Smart Mobile Certificate. So yeah, in the next slides, I would like to highlight several points that we got from the first webinar as a part of this conference, which was held around a couple months ago. Yeah, so yeah, let me start from the background. So as we already know that for mitigating the COVID-19 pandemic, there are several scenarios that can be considered. The first scenario is about the effort related to curtailing interactions between infected and uninfected populations. We can apply several steps in this scenario, such as patient isolation, quarantine, social distancing practice, and school closures. And then the second scenario is how to reduce infectiousness of symptomatic patients. We can apply several approaches such as infection control practices, antiviral, and antibiotic treatment. And then the last scenario is about efforts for reducing susceptibility of uninfected individuals. We can apply a COVID-19 vaccination for this scenario. Yeah, talking about vaccination, there are already several studies which investigate the cost effectiveness of COVID-19 vaccination. And then this is one of the examples. A previous study in the US, which investigated the potential public health and economic value of COVID-19 vaccinations, the authors of this study consider two scenarios for COVID-19 vaccinations, which were age-based prioritization and risk-based prioritization schemes. Considering these two scenarios, the study concluded that COVID-19 vaccinations is cost-effective. Nevertheless, they also highlighted about the availability of COVID-19 vaccines. The study concluded that the COVID-19 vaccine availability is very critical on reducing morbidity and mortality rate. And then they also highlighted several influential parameters affecting the cost-effectiveness value of COVID-19 vaccinations, which were infection incidence, vaccine price, vaccination cost, and vaccine efficacy. Talking about the implementation of COVID-19 vaccination in Asia, the latest investigation conducted by BBC and The Economist, they estimated in which period countries in Asia will be fully covered by COVID-19 vaccination, considering the speed of COVID-19, the current speed of COVID-19 vaccination in Asia. The investigation highlighted that countries in Asia will be fully covered at least by late 2022 or early 2023. There are several factors which might lead into the situation. The first is about the vaccine availability itself. And then the second one is about vaccine hesitancy issues. So those two factors were the most critical factors influencing the speed of COVID-19 vaccination in Asian countries. And then talking about international travel, resuming international travel, the World Health Organization has mentioned that there is no zero risk when considering the potential importation or exportation of cases in the context of international travel. Therefore, thorough and continuous risk assessment and management will help identify, reduce, and mitigate those risks while balancing the socio-economic consequences of travel measures or temporary restrictions against potential adverse health consequences. So there are several points to be highlighted by the World Health Organization. First, there is no risk. And then the second one, the importance of risk assessment and management to identify, to reduce, and to mitigate those risks. Talking about risk assessment for international travel, the WHO have conducted several basic guidelines. So considering the projected 14-day incidence rate in the country of departure, this is the approach how to assess the risk for international travel. So the first question before we are traveling, is the projected 14-day incidence rate in the country of departure higher than the projected 14-day incidence rate in your country? And then you assess based on mortality, testing positivity ratio, testing rates, and testing strategy. And then if your answer is no, so you have to consider the scenario one. And then if your answer is yes, and then further you have to estimate travel volume across all roads, and then estimate several parameters such as increased burden of COVID-19. And then the last questions before classify whether you will be in scenario one, scenario two, or scenario three is the question about, does your country have adequate capacities to detect and cope with the potential additional burden of COVID-19 cases while maintaining other essential health services? So in general, WHO mentions there are three scenarios in risk assessment. The scenario one is focused on the country of departure has a projected case incidence lower than or equal to that of your country. And then for the scenario two, the country of departure has a projected case incidence higher than your country, and your country has adequate capacities to cope with the increased burden. And then for the last scenario, it is similar with the scenario two, but your country does not have adequate capacities to cope with an increased burden. So from these two slides, I would like to highlight that WHO specifically mentioned there is no zero risk for traveling. And then it is necessary to conduct risk assessment before the traveling. And then the latest WHO position paper regarding proof of COVID-19 vaccinations for international travelers, they further confirm that national authorities and conveyance operators should not introduce requirements of proof of COVID-19 vaccination for international travel as condition for departure or entry, given that there are still critical unknowns regarding the efficacy of vaccination in reducing transmission. In addition, considering that there is limited availability of vaccines, preferential vaccination of travelers could result in inadequate supplies of vaccines for priority populations considered at high risk of severe COVID-19. Talking about health certificate or passport of vaccination or immunity, in this slide, I would like to highlight the terminology. So in general, there are two documents, whether for vaccination or immunity document. The first one is certificate, and then the second one is passport. So for certificate, it is referred to a document describing the medical situation of the individual who hold it, combination of electronic and paper-based methods. So for certificate, there are two terminologies, vaccination certificate and immunity certificate. Vaccination certificate refers to proof of vaccination, and then for immunity certificates refers to proof of immunity or low risk of reinfections to COVID-19 through serological tests for antibodies. And then the second one is about the passport. Passport understood as being a one-stop shop for all information to enable travels, such as test results, vaccinations, and details of previous infections. So for this document, there are also two kinds of documents, vaccination passport, refers to proof of vaccination and negative PCR test, and then the immunity passport refers to proof of vaccination, antibodies following infections, and negative PCR test. Those are terminologies refer to certificate or passport of vaccination or immunity. And then in this slide, WHO already initiated a group on smart vaccination certificate to be considered in the future. So in general, the WHO highlighted several major issues. First is about specifications and guidance documentations, which consists issues on a digital vaccination certificate, national trust frameworks, and the most important thing is about international trust framework. And then the second major issue is about country support, white label applications, community of practice, technical support to low and middle income countries to implement this, and then the financing approaches. And then the last major issue is about global digital services. It's about WHO Smart Directory of Public Keys, pre-qualified applications and verifiers. And then the last one is about vaccine product registry. And then WHO already initiated to launch several scenario variations on the implementation of this smart vaccination certificate. So the first scenario, I think this is the most conservative one, is paper first or paper-based only. And then the second one, to consider with the internet network in several countries, WHO also considered the implementation of offline digital health. And then the last one, I think this is the best scenario. It's about the online digital health. Those are three scenarios that WHO has considered on the implementation of SVC. And then talking about global vaccine certificate solutions for COVID-19, in this slide, I would like to present the result of a scoping review. So the study investigated the initial idea from all countries around the world to implement global vaccine certificate. So, yeah, there are already several countries in the world which consider or which have been considering the implementation of this vaccine certificate. Yeah, so there are several lessons learned from those countries. I think I would like to highlight three examples. The first one is from Estonia. They already have a tool or an application entitled Guard Time. In this approach, vaccine guard by guard time can link vaccination record with end-to-end vaccination flow. How guard time vaccination guard helps curb COVID epidemics? So the main idea, they launch a system that can control the supply chain reporting of COVID-19 vaccines from the manufacturer and then delivered to hospital, and then from these healthcare facilities, how vaccine is delivered to the patients, and then how certificate can be launched. So this is the main idea of the guard time. And then the second initiative that we can learn is from Pakistan. They call Vaxify. So the main idea in this approach, they will involve several stakeholders. The first stakeholder is medical institutes as the issuer organizations, and then the wallet provider, in this case Vaxify, and then aviation institutes as the verifier organizations, and also several other verifiers as the verifier organizations. So how is the Vaxify certificate issuance? So patient or person, in this case, person shows their ID to the doctor and then the doctor will verify person's identify, and then the doctors will fill person information and vaccination details, and then the doctor will vaccinate the person, and then at the end, after the process, doctor presents a QR to persons to scan, and then the person will have the certificate. And then for the verifications, it can be used for traveling, for instance, in the airport. And then the last example is digital green certificate that was initiated by the EU Commission. So a digital green certificate is a digital proof that a person has been vaccinated, has received a negative test result, or has recovered from COVID-19. This is digital. This is a digital and or paper format with QR code, free of charge, in national language and English, safe and secure, and valid in all EU countries. So yeah, this is the idea of the document that they proposed. And then talking about ASEAN Smart Mobile Certificate, we have several aims. The first one is to propose the development of standard operating procedure. I think we have been discussing this issue a lot in this policy group. And then the second one is to secure the interoperable system within Asian country members. And then the last one is to enable Asian cross-country traveling activity for business, resident or second home, for tourism, for education with control COVID-19 risk. And then talking about the survey, before the implementation of this approach, we would like to conduct the survey, which captures several questions. First is about the respondents' travel history to Asian country, and then travel plan and purposes in the next 2 years. And then the survey will ask the respondents' opinion on the impact of COVID-19, and then their vaccination status, which type of traveling shall be allowed using this document, and then travel management into groups, vaccinated and unvaccinated people. And then the survey also would like to ask about data security from the respondents' opinion and their interest to join. The survey information, the basic requirement, the traveling shall only be allowed when the risk of COVID-19 is confirmed to be almost zero. And then the additional requirement will include variation of cost, time, effort, data privacy, and security consideration. I think more detail about the survey information will be delivered in the next session. Yeah, talking about the SARS-CoV-2 testing strategies, including the isolation of or the quarantine, I would like to discuss more about the result of studies which focus on the cost effectiveness of SARS-CoV-2 testing strategies in the USA. So yeah, there is several interesting findings from the study. The first one is about the study showed that daily testing combined with a 2-week isolation period was the most costly strategy considered. So in this point, I would like to highlight that a 2-week isolation period with daily testing was very expensive. And then the second one, the authors divided two approaches for this testing. The first is to be implemented in a rapid transmission scenario where the basic reproduction number is around 2.2, which is weekly testing followed by a 2-week isolation period subsequent to a positive test result. For this scenario, when a rapid transmission scenario is considered, a 2-week isolation period with weekly testing is considered to be the most cost-effective strategy for a rapid transmission scenario. And then how is about the situation in low transmission scenario? Which strategy should be considered to be the most cost effective? In the low transmission scenario, when reproduction number is around 1.2, the most cost effective strategy is testing of the population followed by 1 week isolation rather than 2 week isolation. So I think those are several interesting findings from the study on cost effectiveness of testing strategy in USA. And then in our
we have 2 more minutes to wrap up these sessions. Thank you, Dr. Auliya.
Yeah. So talking about current versus proposed practice, in this study, we propose practice for departure, COVID-19 antigen or PCR test or other methods within 24 hours. And then we also encourage to implement ASEAN mobile health risk assessment as suggested by WHO as well. And then for the arrival, if we can consider vaccinated people, so there might be no test required or PCR test when no test during departure. And then, we also consider specific national regulation and mobile tracking if required. And then the next one is about strategies for COVID-19 epidemic control, combining healthcare testing, combination with contact tracing, use of isolation centers, and mass system. Yeah, in general, this approach combination can reduce mortality by 94%. And then this is our proposed as standard operating procedure in Asian departure and in Asian arrival. So we propose PCR tests with a very high quality or accuracy, but time might be long and cost might be very high. And then antigen assessment, we also propose this to be mandatory, and health risk assessment as well. So for tracking, this might be optional. And then for arrival, we propose a mandatory in health risk assessment and optional for tracking. And then this is the proposed parameters in our mobile certificate that we propose. So 14 days travel and health history, including location and health tracing, sign and symptom, including temperature, fever, sore throat, diarrhea, cough, and other symptoms. Health data, including age, BMI, blood pressure, HR, SpO2, and lifestyles, medical history, rapid test, PCR test, vaccine history, and positive COVID vaccine history. And then this is the proposed IT system design. So we propose several strategies. First is dual server system, one in every Asian country members, and the others in Asian centralized server. And then for the secure encryption protocol, we also propose this approach. And then the last one is to ensure interoperability by introducing Asian QR code with specific digital key for verifications. And then this is my last slides. So I would like to highlight 2 key messages. The first is countrywide COVID-19 vaccination could take years in the transition phase where population is partially vaccinated. An innovative ecosystem is required for faster socioeconomic recovery. And then the last one, mitigating the needs of countless integrations among various stakeholders, saving time and funds, while collaborating with existing identity infrastructure can impact post-COVID immunization phase to be faster and low cost. I think that's all from my side. Thank you very much.
Should I continue or the?
Thank you, Dr. Auliya. Yes, Prof. Sanjay, and now is your sessions.
Okay. Thank you, Dr. Auliya, for your presentation. It was a very good presentation. So Dr. Auliya had given an introduction to the prevention and control of COVID-19. Specifically, he had mentioned about vaccination, availability, its implementation, and issues with hesitancy. He also stated that from his review, from the review, as quoted from BBC, that the expected vaccination programs to be completed by 2022 and early 2023, and that there was a need to resume international travel, that there was no zero risk for COVID. The virus has been let out of Pandora's box and we just have to live with it. But he stressed the importance for risk assessment for international travel. He also presented a scoping review for the use and implementation of vaccine certificates and passports. He had given 3 examples: the vaccine guard from Estonia, Vaxify from Pakistan, and the EU certificate. In the end, he also presented some results from modeling studies on cost effectiveness for testing strategies, and he had put up the proposal for the implementation of the Smart Health Certificate. We have a question from the audience, Dr. Aulia. Hope that you can expand on this. From the examples, like from Pakistan and EU, is there success results already being shown from the application and practice of these certificates or passports?
Okay, thank you very much, Prof. Sanjay. So the question about the examples like from Pakistan and EU, is there success result already shown? I think the example from those two countries, currently Pakistan and EU has not implemented yet for the real situation. So they already have an idea, but following the WHO recommendation that it should be it can be implemented when the coverage of vaccinations is already high and other requirements. I think talking about the success result in this step, we can learn that the idea from Pakistan and EU, which can be learned, is about how is the practical of the system. For instance, in Pakistan, so people can go to the healthcare facility, and then the doctor will fill in their data according to the ID, and then after the assessment from the doctor, and then they will get vaccines, and then at the end they can launch the vaccine certificate, which is a digital document. So in Pakistan case, maybe we can see how is the practical of the implementation of a vaccine certificate. And then from the EU, I think we can learn how the idea can connect the implementation of the certificate between countries in EU. So maybe in the context of ASEAN, as we know that maybe the connections of data between countries maybe is very critical or important issue. There should be bilateral agreement or multilateral agreement. Stakeholders from this country should agree the terms and conditions, and it may take a long time before the implementation of this certificate. Maybe those ideas that we can learn from Pakistan and EU.
Thank you, Dr. Aulia. This is a Q&A session, so it is open to the floor. If any of you have any questions you would like to pose to Dr. Aulia or to the group, the working group in general, please feel free to post the questions in the chat group. And we will, when we see questions there, we will basically we will bring it up. So let me go through now. So actually there is another question, but I think it's similar. Is there any digital documentation been practiced before this except COVID-19, for example, for other purposes such as country crisis? So I think the question is whether digital documentation has been used for international travel prior to COVID-19?
Yeah, thank you for the questions. I think in the context of a vaccination certificate, I think there are several examples in the previous vaccination certificates that can be that can be learned. Yeah, but I think
yellow fever comes to mind, if I'm not mistaken.
Yes, that's true, Professor Rampal. Yeah, yellow fever, and for instance, for those who would like to visit Saudi Arabia for Hajj and Umrah, maybe they should provide meningitis vaccination certificate. And then, yeah, I think there are already several examples. Maybe the other group members can also provide added information to answer this question.
So I think we have Prof. Rafee also with us. We have quite a number of attendees. So please feel free. This is open to the whole working group. I do not want to put Dr. Auliya on the spot. It is open to the whole working group. So if anyone else in the working group would like to chip in, please feel free anytime to just on your mic and just come into the discussion. There is another question, and I think this is quite relevant. The question is, how long do you think, or the working group thinks, that it would take to kickstart the ASEAN Mobile Certificate? So this is for the whole working group. If anyone wants to answer, please feel free. Or if not, I have you on the spot. Yeah.
Okay. Thank you, Prof. Rampal. Yeah. So from my own perspective, I think there are several major challenges to implement this certificate. The first is about the differences on countries on conducting or implementing risk assessment. As I presented in my slide, that there are several differences in countries, specifically in Asia, how to assess health risk assessment for travelers. So I think in this case it is very challenging to discuss with all stakeholders in Asian countries to have the same perception in order to implement the same document or approach. And then yeah, I think that's the biggest challenge from my own opinion on how are you taking steps to prevent or minimize them. Yeah, I think in this case what I can recommend is yeah, I think another issue is also about data security among these countries in Asia. So I think in technical there should be official agreement or other supporting documents between those countries. I think this group will discuss further after this conference I
think that is very well said.
Yeah.
That in ASEAN, within the minds we have in ASEAN, I think it's not a problem of brain power, but it may be a bigger issue of trust. Maintaining trust across the region, with all the countries working towards a single trust network, and whether I think that would be key to its implementation. Okay, there is another question. So is this plan to be implemented even when the pandemic is resolved, like a regular travel requirement? So with regards to resolution of the pandemic, I wonder whether to give Dr. Auliya a break.
Just a reminder, if anyone from the working group would like to speak, you can use the raise hand button, then you can be unmuted.
I was wondering whether Associate Professor Rafee would like to attempt this, or anyone else would like to attempt this question?
Yeah, thank you, Prof. Sanjay. Can you please repeat the question again?
So the question is this planned to be implemented even when the pandemic is resolved like a regular travel requirement? So my question actually is, when do you think will the pandemic be resolved?
Okay, thank you very much, Prof. Sanjay. I think every one of us are looking into the end of the pandemic, and unfortunately we cannot know when it's going to end. And if we are looking into the situation right now, we are still declared by WHO that having pandemic in our area. So therefore, it is going to be a common diseases in the next few decades. For example, we have dengue. Now it's already becoming the endemic disease. So I'm thinking of this COVID-19 will be endemic later on. So by having this ASEAN mobile certificate, it will serve in a way helping the travelers to have something health and safety in terms of the security in their mind, when they travel to the ASEAN country. So I would believe that it should be ongoing program that can be implemented among ASEAN countries. Because even though there are so many COVID cases now, but we are more concerned about the fatality rate. So the idea of having this mobile certificate is a very important thing that need to be agreed by the ASEAN leaders. That's my answer, Prof. Sanjay.
You bring up some very, very good points. Number one is it appears to be here to stay for the time being or for the near future. Number two, you also highlighted the fact that we may have to de-emphasize incidence of disease. With vaccination, the disease may be less severe, and we may have to look at other indicators. Thank you, Prof. Rafee. Prof. Rafee, I would like to ask you a question later. You can prepare for this with regards to risk assessment. So Dr. Auliya brought up the risk assessment, which was very interesting. I hope to get your point, but to get your views on it. But before that, I think Dr. Hasliza had raised her hand. Dr. Hasliza, I think you put, do you have a question or do you have some comments?
Hello everyone. Actually, I'm one of the panelists, so I think I should bring up the discussion matter and to respond to one of the questions that been raised from our audience just now. In terms of when should we kickstart the digital traveling certificates and all. As my views as one of the tourism consultants and as well as a tourism experts, I think the industry getting eager now to waiting for when should be the industry will be going to flourish again. The tourism industry getting to kickstart again, getting to be to get attention from all over the world. And on top of that, I think the ASEAN countries also been waiting so much for this kind of solutions in regards to not just for the health scenario per se, but as well as for the economic recovery. So I must say that I think it's time for us, okay, all the experts, stakeholders, to find any kind of solution, try and error, and as well as to look into the other optional solutions. And of course, in terms of we cannot be in silo anymore. So like previously, everyone looking after yourself, but now we have to look into everything, have considerations, economic stability, social well-being, sustainability and resilience, and so on and so forth. So I think that's about time that we have to make a solutions, and also for this policy to be upfront Prof. Sanjay. Thank you so much. That's
Thank you, Dr. Hasliza. Actually, Dr. Hasliza brings up a very, very important point, I think, that sometimes we miss, that health is not a zero-sum game. Health has to coexist with the economy of a country, with psychosocial structure of a country, right? And I think we have come to a point is, the question we should be asking is, how do we open up in as safe a manner as possible, rather than asking the question, when is it safe? It's never going to be safe, I think. Coming back to what Dr. Aulia said, there is no zero risk, right? So it will never be safe. There will always be a risk of COVID. So I think we should move on and ask ourselves, how can we open up in as safe a manner as possible? Prof. Augustine had a question. I wonder whether we can allow her to unmute herself and ask the question. Can the host or the MC unmute Prof. Augustine?
I think can try to unmute.
Yeah, thank you.
Yeah,
yep.
Yeah, can I be here? Can I be here? Okay.
Yes, we can hear you. Yeah.
Thank you, Professor Sanjay, and nice to meet you. It's a long time no see.
Yeah.
Yeah, this is a very important initiative for supporting the mobility among the Asian countries. Since the system will consist on a set of instruments as screening instruments, and also laboratory tests as also screening instruments, I think we have to think also the capacity, validity, accuracy of the system in each participating country. And we also have to have a system to maintain and to assure the credibility of the system in its participating countries. Because we know that we ourselves in Indonesia also experience not good experience when we are dealing with the requirement of having COVID-19 test, for example. So it's very important that we can assure that every system using in every participating countries are good, and then we can ensure the credibility of the system. This is to protect each other. Otherwise, we open, but then the participating country cannot assure that they send valid data of the, let's say, their people to move around the region. So that's my additional remark maybe for this initiative. Thank you, Dr. Sanjay.
Thank you, Prof. Augustine. I think you bring up a very important point, that the accuracy of the system, because the system may be in many countries using many different ways, that there should be adequate monitoring to ensure that the system is of a high quality. I also open this question up to anyone in the working group, if you would like to add anything. Maybe those who knows about the health certificate systems, about monitoring the system within the country. So how will we ensure that that the system will be accurate in the different countries?
Yeah, may I add something?
Please do.
Yeah, thank you very much. I'm Brian from the Executive Office of the President, Republic of Indonesia. Just want to add additional information regarding the WHO vaccine certificate. So this is the additional from what explained previously by Mr. Aulia. But I also want to highlight in here actually is my understanding, WHO not really not put the vaccine certificate for the vaccine as the conditional for the traveling cross country is not really because of the vaccine itself, but it's related with the access of the vaccine. Because we know there is a global diplomacy to access the vaccine, and then not all countries actually can have vaccine to be for their citizen. So that's I agree that related with the for example the effectiveness of the vaccine, or about the vaccine itself, but we have to be sure that we have to understand that not all citizens actually has, access for that vaccine itself because of the vaccine availability. Because not every country can produce the vaccine. Not every country has a vaccine as number of that citizen. So I just want to add that that thing as our consideration to put the vaccine certificate as a conditional for the traveling. Thank you.
Thank you, Dr. Brian. Noted about the WHO vaccine certificate. There was a question. Digital certificates are for ASEAN. So we are doing this under the AUN. So we're talking about ASEAN digital certificates. So the question is, how about those foreigners who are residents here for a long time? So long-term residents of ASEAN countries, I guess, will they be eligible to get this certificate? Open this up to the group.
Can I share?
Please do.
Yeah. So I think every people living in ASEAN countries, they are eligible to access and use the system, because we are talking about people, whether they are citizens or not of ASEAN countries. So as long as they are living in ASEAN region and they have business in ASEAN region, so they have the access to use to this proposed system. That's my opinion. Thank you.
Thank you. So we're talking about ASEAN residents and not ASEAN citizens, I guess. So anybody who is a resident here, this will apply to them.
I would definitely agree to that.
Yep. There is another question, but I think this question is repetitive. It's like, how long do you think it would take to kickstart the ASEAN mobile certificate? So should I put anyone on the spot and say, when is the expected timeline for its roll-up?
Is it the same question just now? I believe that is the same question.
So yeah.
Prof. Sanjay, may I add something?
Please do, Prof. Rafee.
Because just now I hear that you wanted to ask me about the risk assessment with regards to this ASEAN mobile certificate. Now, in addition to what we have right now, talking about the vaccination, travelers and whatnot, I think one of the most important thing in risk assessment is how do we generalize in terms of the similarities when we define the risk zoning. You see, so some of the countries, they might have different, indicators of high risk, the medium risk and the low risk. So we need to come into agreement how we are going to identify what is the best criteria to define. When we talk about the risk assessment, there are many methods available, whether you are looking into the qualitative way, the semi-quantitative way, or the quantitative way. So perhaps the Asian country would sit together and have some, mutual understanding using the same criteria to define the risk zoning. This is very, very important, because if, let's say, we don't have agreement on this, perhaps when you come to one ASEAN country, it should be red, but it is indicated as yellow, you see. So this is what we need to avoid in terms of the similarities of diagnosis, in terms of similarities of the, the likelihood and the severity of COVID-19. So I believe that this is going to be our next step in establishing the items or the risk factors when we determine the risk assessment metrics. Thank you.
Thank you, Prof. Rafee. I think Prof. Rafee brings a very important point, which is that the risk zoning or risk classification should be harmonized among the countries. And I think that's very important to increase the trust among the countries so that we use this common certificate. I think that's a very important point. Thank you, Prof. Rafee. There is another question. Will this mobile certificate also be recognized for travel outside ASEAN? Will we tie this up with the EU pass, with the EU passport, or with any other regions?
I think that will be the next steps, Dr. Sanjay. If we can agree that this system will be applied in Asian region, and we can show that it's effective system, then we can propose to another region that we have a good system and they can rely on our system. But first, of course, we have to apply in our region first and then show to the world that we have a good system. After that, we can propose that you can rely on our system. But that will be our collective goal, yeah, for that as a region.
Yep, I think I fully agree with that, because ASEAN as a bloc becomes a region with large population. If we all harmonize and if we all utilize a certificate, then the certificate represents a large proportion, a larger population. And that, I think, using the ASEAN region, ASEAN bloc, makes it easier for us to negotiate with other regions, and that makes it easy. But I guess first we have to have the certificate. Yes. First we have to harmonize these issues within ASEAN. Yes, I agree with that.
Agree.
Okay, there are a few questions now. Can you, so there's one question, can you ask feedback from Prof? So Prof Tipawan, do you have any feedback that you would like to provide? Or Prof Trung Nguyen? These are other members, I guess, these are other members in our working group.
At this moment, I don't have anything added.
Thanks, Prof Tipawan. And Prof Nguyen?
A reminder that we have around 3 minutes to wrap up the discussion sessions. Thank you.
Okay, thank you. While we wait for Prof Nguyen to provide any feedback, there is another question. In principle, the same treatment given to ASEAN may need to be provided to non-ASEAN countries. So the principle of non-discrimination, perhaps rather than waiting till the system could consider it now. So I guess this issue is, how do we ensure that non-ASEAN people who, when they come into our region, will not be discriminated by the so-called use of a single ASEAN passport or certificate, sorry. Something to think about later. If anyone has any
I think if we traveling around Asian countries and we are going to the immigration, that will be different line between Asian countries and another foreigners who come to the country. I think we can apply similar approach, because Asian lines are already available in almost all of our countries. Then we can ask, this is for Asian countries, then there will be a special a special treatment on them, and there will be another line for non-Asian passengers. That there will be another system to serve them. I think that's one of example where we already applied in immigration, that we applied differently between passengers from Asian countries and non-Asian countries. Maybe this also can be applied to this system, certificate, this health certificate.
Thank you, Prof. Yeah, I totally agree with that. And I think the system, there's already a system overseas. So when you go to EU countries, for example, EU citizens have a separate line. Immigration control is separate, right? And we're using the same policy, same principles here. The only thing is for the ASEAN line, there may be ASEAN passport line and ASEAN people without the certificate and people with the certificate. I'm looking at the questions and answers, so that there is no further question. There is a question on, is the SOP will be implemented as a preventive measure for the, so are there SOPs will be implemented, are there SOPs to be implemented as preventive measures for the future pandemic situation? So I guess this question deals with developing, one of the objectives was to propose to develop SOPs. So anyone wants to talk about SOPs right now? Or I think there are many SOPs in many countries. So thanks, Yoong. Are we out of time?
We still have 30 seconds to wrap up.
30 seconds, so to wrap it up. All right, so to wrap it up, I would like to thank all of you all for providing feedback, and all those who have asked questions, thank you very much for keeping this discussion engaging. And I do not want to overrun time because I value your time. So with that, I would like to thank you and pass it over to Yoong. Will I be passing it over to you, to the MC?
Yes.
Okay,
Yeah, thank you, Prof. Sanjay. Thank you, Dr. Auliya, and thank you for all the working group members for sharing their insight. Now, I would like to invite the presenter for this session to present the online survey result. Associate Professor Dr. Rafee Baharudin. The floor is yours. Thank you.
Can you see my slides?
No, not yet. Yeah.
Not yet, huh? Wait, huh?
Yes, now we can see your slide.
Okay, thank you very much, Mr. Master of Ceremony, my colleagues, Prof. Sanjay.
Where shall I go?
Dr. Aulia, and then the rest of the working group. And today I'm going to present one of the most important survey results with regards to the implementations of a smart mobile certificate. Okay, now we have altogether 14 questions, results, and then 7 of concerns that are going to be highlighted. We have initially 218 respondents based on our survey, and majority of the respondents are ages between 31 to 48, that sum up to 32.7%, followed by 21 to 30 years old, 41 to 50 years old, more than 60 years old, and last but not least, 51 to 60 years old. That is 8.4% of the respondents' variations. And if you look at these charts, most of our respondents are actually coming from the university sites that contributed 86.3%. And others are from the government bodies, the industries, and our NGO counterpart. The next result would be the participating country in the survey. 48.6% coming from the Indonesia, followed by Malaysia, Cambodia, Thailand, Philippines, Myanmar, Brunei, Laos, and Vietnam. Okay, we also asked about the travel history to ASEAN country, and 64.2% of the respondents have experience on at last traveling history throughout ASEAN country more than 2 years ago. And if you look at this pie chart, 22% did not travel between that particular years. Now, the next result would be on the previous traveling experience, actually mainly for tourism, contributed 44.2%, followed by education, business, and travel. And the rest of the respondents are actually saying that the traveling is because of their second home, research, Olympiad, and healthcare. Move on to the travel plan and propose in the next 2 years. So 72.6% respondents have planned to travel to other ASEAN countries in the next 2 years. I think this is actually depending so much on the numbers of COVID-19 all around the Asian country as well. Perhaps this number would be increased over time. And then the next result would be on the purpose of the upcoming travel plan, and 73.4% are actually looking into going for tourism. Right, and then 54.8% are actually on education purposes and business traveling. So the rest are for second home, research, and workshops. Now, we also asked about the impact of COVID-19, the social impact, the disruptions to vacation and tourism, study and education, business and economic impact, disruptions of research collaboration. So the answer shows that respondents confirm that COVID-19 gave impact in disruption to vacation and tourism. So this is the most impact to our respondent, that is contributed 71.6%, and followed by study and education 60.5%, business tourism 59.5%, social impact 50.2%, and economy 36.3%. The rest are due to the disruptions of research collaborations. And this might be because of our respondents are more among the university members. So the next question is on the vaccination status. If you look at this pie chart, it is clearly stated that 71.8% respondents don't have experience taking COVID-19 tests during the last travel, and followed by 15.7% taking the COVID-19 PCR test and 8.3% COVID-19 rapid test. Perhaps this is something to do with the country requirement as well. Now, the next one will be majority of the respondent, 88%, have received vaccination within 6 months, while 7.9% respondents have not received any vaccination, and 4.2% have received vaccination within a year. The next question, we also asked about which type of traveling shall be allowed. So there are a few variables here, whether it is business purposes, second home, tourism, education, labor and low-skilled workers, low-cost travel. This is referring to backpackers, travel with no motive, social and sports. And the result shows that majority of respondents agreed that the education contributed 88.9%, followed by business, 75.5%, tourism, 65.3%, labor, low-skilled workers, 30.6%, low-cost travel or backpackers, 30.6%, and traveling should be allowed with the implementation of Smart Path certificate. So this is something about the travel management. We also asked about the vaccinated and unvaccinated. And if you look at the results, 66.5% agreed the traveler should take both rapid tests at origin and destination before travel to the other country. And also, when you look at this result, 67% agreed that travelers should take both rapid tests at origin and destination before travel to other country. So this is for vaccination, for travel and return trip. Now, what about the unvaccinated? 80.4% agreed that the traveler should take both rapid tests at origin and destination before travel to the other country. And similar go to the return trip. 80.5% agreed the traveler should take both rapid tests at origin and destination before travel to another country. So this shows that the importance of taking before and after, before destination and the origination country. So this is something to do about the data security. Well, as we have been discussing earlier, most of us are agreed about the security and privacy of data protection. And this result shows that 91.5% of participants agreed. Okay, this is very important when we want to implement the ASEAN Smart Mobile Certificate for traveling. We have 7 concerns that need to be looked into seriously based on the respondent feedback. The first one is the wider adoptions of contact tracing application. So this is something to do with risk assessment in terms of zoning, whether it is high risk, low risk. So how do we actually keep track on that? And then they are also worried about is there another pandemic coming? So we need to have a very good statistics, a very good risk assessment methodology, in order to identify it as to prepare on the situation. And then all Asian countries can allow travel with vaccine card. So this is something that we need to look into as well. And then prefer more people who travel have to do PCR tests. PCR test, vaccinated or non-vaccinated, and quarantine is a must in the origin and destination country. So if you look at one of the concern from the respondent is to ensure that everyone who are going to travel within the Asian country should be quarantined. I don't know whether 10 days, 14 days need to be decided later. And then and data safety and the digital certificate can be scanned with scan system, but a minimum information is being allowed to be seen. Meaning to say, if let's say we have so many data inside individual data, but the only important things, perhaps five major elements that need to be highlighted. Okay, not all can be seen by the authorities.
A reminder, the times is up.
Okay, and then crime take opportunity during focus weighted to COVID issues and the quarantine issues. So as the conclusion and remarks, we have 218 respondents. 72.6% have planned to travel in the next 2 years. So therefore, the implementation of this mobile certificate is an urgent thing, need to be think. And they agreed that to use the ASEAN Smart Mobile Certificate, and they think it benefits majority of the sectors. And we are actually concerned that the security, 91.5%, the implementation protocol and standard procedure that will be implemented to look wisely. Thank you very much.
Thank you, Prof. Terima kasih. Thank you very much for the interesting sessions with our first topic speaker, Dr. Auliya. And thank you for the moderator and presenter for contributing to these sessions. I would like to remind all of the attendees to fill up the attendance by answering the survey link through the chat box. During the discussion sessions, it is welcome for the two-way interactions with the speaker and also with the moderator. You are allowed to unmute yourself. The upcoming topic is very significant, part of the recovery phase from the pandemic. The benefits of the discussions will be tremendous to the economy sector. Yes, the topic is ASEAN SME Internationalization Policy in New Era. Now, I would like to introduce you the presenter, the moderator, and speaker for our second discussion topic today. The presenter for this session is Associate Professor Dr. Nguyen Trung and Ms. Shochrul Rohmatul Ajija. Associate Professor Trung, he is the head of Department of Management, School of Business and Management from Vietnam. He holds a PhD in Public Management from Monash University, Australia, with experience in teaching in international business programs. Our second presenter for this session, Ms. Shochrul Rohmatul Ajija. She is currently a lecturer at Department of Economy, Faculty of Economy and Business in University of Erlangen, with a master's degree in economy from International Islamic University, Malaysia. She has research experience in economics and analysis of the performance of the microfinance institutions in Indonesia. These sessions will be moderated by Professor Dr. Raditya Sukmana. He is a professor in Islamic economics in Universitas Erlangga, Indonesia. He holds a PhD in economics from International Islamic University, Malaysia. His experience to the topic as a reviewer of International Journal of Islamic, Middle Eastern Finance and Management. He was the director of Islamic Economics Forum for Indonesia Development from 2004 until 2007. And he is also the head of Islamic Economics Study Programs for a doctorate degree in University Erlangga from 2019 until present. Ladies and gentlemen, now I would like to introduce you the speaker, Associate Professor Dr. Telisa Aulia Falianty. She is currently the Assistant to Presidential Special Staff, Indonesia. She holds a PhD in Monetary Economics from the Departments of Economics, Faculty of Economics, the University of Indonesia. She has experience as an economist at World Bank, Jakarta. Besides, she is also a member of working group at National Economics Committee and Industry. She is also the Programs Director of Master of Public Policy. We will now continue to our second topic of today, the final discussions on ASEAN SME Internationalization's Policy in New Era. Associate Professor Dr. Telisa, the floor is yours.
Thank you, Mr. Yoong. Thank you for the opportunity. Good morning for all participants of this policy group discussion. So now we will talk about SME. That's the part of talking about the economic recovery, because we know that ASEAN has SME. The role of small medium enterprises in ASEAN is very significant for the ASEAN economic recovery. So I will try to share the screen. Okay, we are from the working group 2. We have the team Professor Dr. Raditya, Associate Professor Trung, and Ibu Nisfu, and also Ms. Shochrul Ajija. Okay, we will talk about the SME internationalization here.
Dr. Telisa, we're still waiting for your screen. Yeah, we still haven't seen your screen yet.
Okay, currently, how about the screen?
Still waiting the screen to be shared. It shows that it started.
Okay, how
Can you
about
try again?
Okay, it's can you see my screen?
Still waiting to start actually.
Okay, maybe for the committee, maybe
the person in charge for this, can you share your screen to help?
Yeah. Okay, the person in charge can share the screen.
Mr. Ahmad. Dr. Telisa, maybe you need to stop sharing the screen first.
Okay.
Hello, Mr. Ahmad, are you here? Can you share the screen?
Yes, I shared already. Can you see my screen right now?
Yes, I can see your screen now.
Dr. Telisa, can you see?
Dr. Telisa, is this the view that you want? Sorry for the technical. I think we wait for Dr. Telisa for a bit. Is Dr. Telisa still here? Hello, Dr. Telisa, you are still mute. Yeah.
Cannot unmute. Sorry.
Okay,
can
we
I?
can hear you.
Okay. Yeah. Can I present? Currently,
yes,
sorry for the
technical
problems in one of my laptops. So can I present now?
Yes. Thank you, please.
Yeah. Maybe you can remove one of my files and can go for the committee that to share screen.
Sorry, remove the file.
Yeah, remove the last one. Yeah, and so can I start for the presentation?
Yep. Please scroll down the next slide. Yeah.
Okay. Please scroll down to the, okay. Sorry for the technical things. Okay, this is the continuation from the webinar 2 that at that time we have the implementation plan regarding the ASEAN SME. There are some points here that SME policy and then SME networks and also about talking about ASEAN SME digital platform and also how we could develop a small medium enterprises database in ASEAN for some priority sectors and also developing ASEAN SME consortium network development to strengthen internationalization of SME, including the problem solution sharing center and also regular SME product exhibition and SME information sharing as well as SME's capacity building. Next slide. Okay, we also in the IC Blueprint 2025 for the highly integrated and cohesive economy, competitive, innovative, dynamic ASEAN, and enhanced connectivity and sectoral cooperation, and also a resilient, inclusive, people-oriented, and a global ASEAN. Next slide, please. Okay, in ASEAN, we already have what's called the SME Policy Index. So there are some indicator here talking about the policy index in ASEAN. The first is about the productivity, technology, and innovation. The second one is about environmental policies, access to finance, access to market and internationalization, institutional framework, legislation, entrepreneurs, education and skill, and also social enterprises and inclusive SME. So we could see here there are some focus of policy in the COVID area, era. The first is about technology and innovation, and also integration to global value chain, and also about the quality standard. So our working group currently focusing on the three parts of the component of the policy index here, yeah, because it is very, very relevant to sustain the internationalization of SME during the pandemic era. Next slide, please. Okay, this is the objective of our discussion today. The first is to identify the most important factor to sustain SME internationalization and also the competitiveness in COVID-19 era. And also to map the SME policy response in ASEAN to survive in COVID-19 and how to harmonize it. And the third one is to recommend the policy action in ASEAN SME digitalization and connectivity, and to recommend the policy action in the ASEAN SME innovation. Next slide. There are current research from area is Asia Research Institute in ASEAN plus 3 countries that recommend ASEAN SME policies in COVID-19 world. The first is the upskilling to success ASEAN MSME in the digital economy, and how the micro firms can support by the access to skill, access to finance, and also access to markets, and also women and participation, and also about the leaderships, yeah, in the digital economy. And also how about the fintech in many ASEAN MSME could support the ASEAN MSME development. And also to understand and supporting the emergence of innovation ecosystem and startup as the key hotspot that can drive the recovery of the small medium enterprises in ASEAN. Next slide, please. Okay, there are some new trends in current trade in ASEAN, especially in the goods trade in goods and services. The first, because the result of the loss of income and economic uncertainty due to the pandemic, demand for goods and services has been declining in ASEAN members, and the WTO reported that up to 80 countries and separate customs territories introduced export prohibition or restrictions. Exports were restricted to prioritize meeting the domestic demand, and import, on the other hand, was loosened, yeah, in terms of the restriction for goods, especially in high demand, such as medicines, medical supplies, and also foods. Restriction on the international travel and border controls have increased the cost of doing business and prevented tradable goods and services from being supplied or consumed. This policy brief examines trade policy response and measures that have been introduced across ASEAN in times of the COVID-19 to ensure that trade connectivity remains in fact to facilitate post-pandemic economic recovery. Next slide, please. Okay, among around 163 import measures, there are 134 were liberalizing, while the rest are restrictive. The most common measures were tariff or import duties reduction. There are 42 restrictive imported measures terminated. So there are two trends, whether it's more liberalizing and whether it's more restrictive. So we can see the mapping, yeah. Next, in the next slide. Next slide, please. Okay, yeah, this is the map. So this is the number of trade and trade-related measures issued by ASEAN members during the COVID-19. So among the 100 trade measures have been issued by ASEAN member states. Yeah, among these, 62 measures were liberalizing and 38 measures were restrictive, such as export restrictions. Among ASEAN member states, Indonesia issued the highest numbers of trade liberalizing measures. On the other hand, Vietnam issues the highest number of trade restrictive measures with 4 measures. The number is still lower than India, who implied the 7 measures, and Russia with 5 measures. Next slide, please. Okay, this is the ASEAN and MSME in time of crisis response. Yeah, we understand that small medium enterprises dominate the business demography in ASEAN region and contribute significantly to job creation. Across ASEAN, medium-sized firms are low in number, as MSME generally remain small without growing. And the policymakers has the support also to access the skills, access to finance, and access to market to enable them to grow and scale up. And the research also saw that the export-oriented SMSE are better able to adjust to crisis. So the issue, the message about how we maintain the ASEAN competitiveness in SME, small medium enterprise, is very important currently, and how to harmonize it. Next slide, please. Okay, this is the COVID-19 and trade policy measures in ASEAN, especially for ASEAN countries are amongst the largest exporters of the PPE products. Yeah, PPE means the personal protection equipment products such as masker, pharmacy products, and hand sanitizer. And ASEAN supplying about 25% of total global exports of these PPE products. Yeah. And Malaysia were the largest contributor of the global export, followed by Thailand. In the same year, ASEAN also imported around 3% of total global imports of PPE. The restrictions mainly were intended mainly for securing domestic supply issues. Next slide, please. Okay, ASEAN realized the importance of regional and inter-regional cooperation and keeping market open to mitigate the impact of pandemic. To operationalize ASEAN commitment, currently we have Hanoi Plan of Action on strengthening ASEAN economic cooperation and supply chain connectivity in response to the COVID-19 pandemic. So the ASEAN Minister of Agriculture, for example, has ensuring that the market of trade lines remain open and refrain from imposing new export control or non-tariff barrier. Next slide.
Hi.
Okay, next slide. There are several mutual recognition that we should discuss. Yeah, how ASEAN could identify the new mutual recognition agreement in the new normal area. For example, health certificate, like Working Group 1 has talking, health certificate in the export and import procedures. Yeah, we should discuss about that. Next slide, please. Next slide, please. Maybe this is the mutual recognition in ASEAN. We should comply with the free flow of goods in ASEAN to minimize trade protection and compliance costs. But this is the new role because of the pandemic. We still need the security. We should ensure that the product is free of COVID, for example. So talking about health certificate here for the quality standard as the component of the SME policy index is very important. Next slide. Can we go to the conclusion slide? Because we can discuss more. Actually we have several discussion, but I think we should go to the conclusion because of the limitation of time. Okay, go to the conclusion and take a conclusion part. In front of conclusion is before the thank you slide. Okay, for the conclusion, a production network in ASEAN should be maintained. And to ensure supply chain connectivity, particularly of essential goods, ASEAN could need health certificates. And to allow the factories to resume production, seller to access greater market, and restoring business and consumer confidence is very important. And to propel ASEAN digital agenda by addressing the manifold digital gaps that digitalization entails, including security and ethical concern, including SME capacity building in adapting digitalization, and also to support the role of private sector and other stakeholders, including higher education and university, in instilling confidence in the market, promoting new business model and opportunities, and facilitating the post-pandemic recovery. For this one, maybe there are some additional from my college. Professor Tu, maybe 1 minute you can add the explanation about the global value chain, maybe as the case of the Vietnam. Please, Professor Trung, the time is yours for 1 minute additional things.
Thank you very much. Can you go back up to the 2 slides, please? Can you? Yep.
Yeah, this red slide. Yeah. Okay.
All right. Very, very brief ones. Not sure whether you see my camera on this yet. But very quickly, time is short, so thank you very much. It's my pleasure to join the team to talk shortly about the Vietnamese case. So we're adapting the diamond model of Porter. So we talk about bond global firms. We don't have time to talk about this, but it's not emerging yet for the case of Vietnam. I believe in ASEAN as well, but for the future, gonna be great for ASEAN, to have these kind of firm. For firm strategy and structure and rivalry, we have those item and factors there. You can see in the screen. Only 1 minute we can go up, but we have the favorable and also the challenging in each of them. For the factor conditions, if you look at the case of Vietnam and for most of Asia, we have climate, landform suited for agriculture, but at the same time, we have the problem with the access for the formal credit, doing very low for this firm. One of the important for internationalization is also for the global value chain is we need to have the related and supporting industry. But the problem for Vietnam and compared to other countries, Vietnam even more serious is the weak local supporting industry. And also because of COVID, we have some shock in the labor supply and also the low spillover effects. Can you go down to the next slide, and then that's it. All right, and the other factors do factor in the diamond model is the government and risk and chance. So it may be for Vietnam, but also for your case. Vietnam have an issue of logistic costs still very high, and then that's the issue for MSME as well. But the good point is that we have a lot of recently have the free trade agreements with European and CPTPP and those things. So it makes the trade barriers less and create some competitive for MSMEs in Vietnam. Recent chance, COVID-19 is, they say that is the, doing better job than any CTO in any company. So they promote the digital transformation and they have to adapt new technology and trade wars. They have risk, but also they provide some opportunity to diverse to Vietnam and other markets. And finally, technology, you see that fast adapting to digital transformation. The problem is that productivity remains very low because of the research and innovation is still low in these type of firms. So we can explore more and we can discuss more in the Q&A, but given the time that we have, so I have to stop my presentation here. I'm happy to take joy Professor Telisa to take more questions. So I hand it back to Professor Telisa for your next presentation.
Yeah, thank you very much. I think our presentation has been finished and we're going back to the moderator and MC. Thank you very much.
We still have 7 minutes for your session.
Dr. Lisa, can you hear me?
Yes. Okay. So we move to the moderator. Thank you.
Can you hear me?
Yes,
I'm in.
Yeah, I can hear you.
Sorry for the technical problem.
Hello, Prof. Raditya. Now we are losing you.
Yeah, I think Professor Raditya have some issue with the internet connection.
Okay, if I still have the time, could I present again some
Yes,
additional?
you still have 6 minutes for the presentation time. Yes.
Okay, for the committee, could you share screen again?
We discuss.
Oh, okay, Prof. Raditya has already good in the connection.
Okay, can you hear me?
Yes.
Yes.
Okay, sorry for the technical problem. Right. So actually, can you please share the screen, Ibu Yati? I put the questions already, but if it is not, then I try to share my own. Okay. Can you just wait a minute? Hold on. Sorry. Can you see the question right now?
Not yet. Mr. Almar, can you stop sharing first? Yeah. Prof. Raditya, you can try sharing it now.
Oh, okay. No, I have a problem. Hold on.
I think I might have to stop sharing and then release. I can do. Yes, better now. Yeah, we can see it now.
Okay. From the webinar one, the section 1 is about the health, and also after this we have tourism. So for those of you who are right now here as a participant in a Zoom meeting, for those of you who are expert in the tourism, economics, and so on, do you have any experience whereby the SMEs product can attract the tourists? Is there any case whereby SME can produce product health issue to mitigate the spread of the COVID-19? Would there be any evidence that the SME product is related to health, like supplements, herb products, which is important to build immune? So for those of you who are here as a participants, you may open your mic and then discuss, please. Anyone?
Hello.
Yes.
All right. Thank you so much for the questions. I'm one of the panels, and I represent the tourism industries and tourism aspects for the working group. All right. Thank you so much, Dr. Telisa and Prof. I would like to respond on in the matter of whether or not the SME product. Actually, I already put on one of my questions in the chat box. Basically, worldwide, and if I would like to raise a Malaysia case, most of the tourism operator or tourism related operator, basically they are all SMEs products, and this pandemic, or what we can so call as in the tourism context, the tourism crisis. In any tourism crisis, SMEs, tourism SMEs will affect the most, since they basically tourism is no longer become their alternative income generation or alternative employability. However, it becomes the main in the industry, especially in ASEAN. And if I want to focus on the Malaysia, yes, it's become the main contributor to the economy. So in relates to the questions that you raise on what kind of SME products. Yes, most of the SME products that relate to the tourism, basically in trend now is the community-based tourism that are being introduced to so many countries, especially in ASEAN, where we have homestays. we have small handicrafts industries. We have food industry that relate with the small entrepreneurs, and as well as the souvenirs to the tourists. So when the tourism crisis, in any tourism crisis, but of course COVID-19 become the main, because it's longer than the others, so its effect too much to the supply chain itself. And whether or not no doubts that this any solutions into the SMEs industry will pretty much looking into the main solutions to the tourism related SMEs. So that's my response so far. Thank you so much.
Thank you, Dr. Hasriza. If I may continue from your explanations, do you have any case whereby you know one or two SMEs during the COVID is even getting more profit? Maybe because they can produce product in which during this pandemic people are looking for. So do you have a case like that?
Yes. Even before the pandemic, even before the pandemic, the tourism industry try to look into how we want to how the industry will survive, especially for the small operator, because most of the tourism industry has been taken over by the big boys. So
right.
These small operators basically depends on the middlemen, or basically the travel agent, to bring their tourists to the sites. So the product innovations, and as well as product enhancement basically become in place to make sure that the tourism operator can survive even without the helps from the middlemen and so on. So we have one examples in Sabah, which is one of the homestay programs that have been introduced by the Ministry of Tourism Malaysia, Mohd, and the homestay has been in charge for about more than 20 years now. So what's happened when tourism trends become changed throughout the time? So people don't want to see the same things for the past 20 years. So normally tourists will go revisit again the place if there are new products in place. So for this, the tourism industry or the tourism player, as well as the stakeholders, take into the initiative to make the homestay more creative, whereby it no longer depends on bring the tourists to the sites, but their income generations basically on the conservation. So this will relate to when the pandemic comes, so the tourist is not coming, so they will spend their time and their income generations move to the conservation income generation, which is the reforestry. So that's a part of the SMEs products that have been produced to replace the tourism related businesses.
Thank you for the good points, Mr. Dr. Hasriza. I have two participants raise questions. Let me allow. There are two. I give a chance for those of you. First is Miguel Angel Esquivias. Can you open your mic and then answer questions, Miguel?
Great. Okay, thanks, Prof. Raditya. Okay, very shortly. Actually, yesterday I presented a paper in which we were studying precisely that link from trade towards tourism. And then in the ASEAN case, we find that implementation of the ASEAN agreement, the free movement of goods, capital, people, etc., it's actually creating a positive impact in tourism, which means that any substitute effort in increasing this free mobility of goods, etc., can help to increase tourism. And the other thing we find there is that those countries are actually, between the ASEAN countries, we are actually looking into each other in terms of differences in culture and ways of living. And I suppose also the medical things may represent a new source of tourism. So I think definitely yes, there is a link between trade and tourism. And the farther we go away in trade, the more tourism we can expect within the region. Thank you, Prof.
Okay, thank you, Miguel. Yes,
Prof.
you want to
Raditya,
respond?
sorry, can I
Telisa?
respond to the
Yeah.
two parts before we go to other question and
Bu
response?
Mila, yeah. Yes, please, Bu Telisa.
Thank you, Prof. Raditya. So thank you, Dr. Hasliza and also Mr. Miguel for the inputs. Yeah. So if I maybe the first of all, that we need some innovation. Yeah, like we already talked that for the pandemic, we can adjust with this time of crisis that we do some adjustment. Yeah, how we can adjust. So when you said that there are the nexus very important between trade and tourism, I agree with that. Usually because sometimes when we talk about tourism, there are also tourism that related to business, to business things. So I think how the nexus between trade, tourism, and health currently is very, very important. And how about if we're talking about the innovation, we can learn from Malaysia, for example, that Dr. Hasliza has already said that about the how the SME can be shifting, how we do some diversification models, how we do the new ecosystem. For example, homestays and also maybe outdoor tourisms and maybe some adjustment of that. And also how sometimes currently also the new trend. For example, there are the health tourism. For example, we go to United States for the vaccines. It's some example of the that the tourism maybe could relate with the health sectors and should be supported by the health. So we really thanks for that sites, and I think the tourism in the futures, how we know that the SME has has a large contribution in the tourism sectors, and so we should give the adjustment tools, to the SME, how they can easily adjust for the new model of business. So they should learn how, and the governments and all the stakeholders should support how the SME could adapt with the new normals, with the new models, new business model. For example, the tourists with vaccine certificates, tourists with that more that can do a physical distancing, tourists that could also digitalize, so there are many adjustments that we could learn. So I think this is very insightful input for our study about the SME new normal, SME, how SME adjust in the new normal era, including in activities or in the tourism activities. So thank you for all input. Thank you, Prof. Raditya, and
thank you,
Mr. Miguel.
Thank you. Before, okay, there's another one from UI, but I allow Professor Trung. Maybe you want to add some more about the trade, tourism.
Just now we have participant Mila raise hand as well. Just to remind you.
Yeah. Professor Trung, you want to add something?
I think I can come back after the answer the questions. From and
okay.
I will join.
Maybe because Prof. Raditya said,
Yes. Thank you, Prof. Trung. Ibu Mila, can you open your mic and then ask questions? Madam Mila, you have been lower down your hand, but yes, please.
I'm still here. Yeah.
Okay, good.
Okay. Good. Yeah, thank you very much, Professor Raditya, for giving me the opportunity to raise my question. Ibu Telisa, thank you very much for your presentation. It is very interesting, and I also have the same interest in the small and medium enterprises research, but my focus is on occupational health and safety. So as far as I found in the field that the issues about health and safety in small and medium enterprises is still very limited, especially the support from the regulation. I believe that Ibu Telisa probably have more access to discuss about health and safety regulation in small and medium enterprises in Indonesia. So if we refer to Act number 20, year 2008, regarding small and medium enterprises, we can see in that regulation that the issues about health and safety has not been mentioned anywhere at all. So I guess that we already understand that the contribution of small and medium enterprises into Indonesian economic is very significant. Now we need to probably think about how we can actually prevent and promote the health and safety of the workers in small and medium enterprises. As we probably also aware from one of the OECD report regarding tourism, the Indonesian tourism status actually in general sit at rank 40 out of 140, which is quite good. However, regarding health and hygiene and then safety and security, we have the lowest score in the OECD report regarding tourism. So health and hygiene and safety security issues in tourism in Indonesia is very low. I think now we need to consider how we can actually improve the regulation of small and medium enterprises in Indonesia to also add some regulation regarding health and safety for small and medium enterprises, especially during pandemic. Yeah, especially during pandemic, it is very critical because they have very limited knowledge regarding health and safety, and also due to lower educational level for the workers and the owner of the business. I think the government need to move forward, especially for Ministry of Cooperation and Small Medium Enterprises, to revise the act on SMEs, Act number 20 year 2008, to also include the issues about health, safety and security. I think that's my question. So probably from other countries also they can share their experience in regulating health and safety issues in small and medium enterprises. Thank you very much, Dr. Telisa. Thank you.
Thank you, Madam Mila. Okay, let me go into there's another one. Professor Fatma Lestari, can you please open your mic and ask questions?
Yeah, thank you very much, Professor Raditya and also Dr. Telisa. I would like to probably endorse my colleagues previously, Ibu Dr. Mila, to include or to integrate with the health certificate in regards the SME. We can see or benchmark under the Tourism Ministry of Indonesia, they include the certification of THSE, cleanliness, health, safety, and environmental. So I think these best practices can be adopted into the small, medium enterprise. And also another one is to include business continuity plan. What has been done in Indonesia, the Ministry of Manpower and Transmigration has released or issued the business continuity plan for SMEs to ensure that their business is continuing during the pandemic. So I think those 2 points that I would like to include, Dr. Telisa, into the system. Thank you very much.
Thank you, Professor Fatma. Let me go into Mr. Yoong. How much do we have time? 8 minutes, right?
We still have 10 minutes.
Okay. So can we go to the second questions? This is with regard to the IT, right? What can IT do to support SME towards internationalizations? We know that during this pandemic, even before pandemic, we had the issue of industrial revolutions 4.0. And this pandemic, the stress is more. So any participants would like to have say on that issue, please, you may open your mic. Professor Trung, you may open your mic, please.
Yep. Thank you very much. I think I pretty much agree with what of our presenter, also my college have just presented. For my opinion, I would love to start on 3 important things for MSME, for Vietnam, and also for, I believe, for other countries as well. Number 1 is the competitiveness, right? Number 2 is technology. And number three is how to respond to the COVID issue at the moment, right? So regarding the competitiveness, now it's very easy to approach the market. So technology will have our firms, small firms, to reach out to the world market easily. Of course, there's barriers there, lack of information or language, everything you can name a lot there. But anyway, it's much easier compared to in the past. So technology, if the firm adopts well, and then they open up a high avenue to go to the global market. That's number one. So any firms at the moment, if they, and with the support from government, I think they can have a better chance to approach the world market. And competition is a lot there as well. So that's why competitiveness of the firm is important. We can look at the labor, the factors, condition, but also you look at the related and supportive industries. If you want to compete, you have to keep the cost down. And if you keep the cost down, it relates to many things: the government policy, tax policy, and also, the soft infrastructure and hard infrastructure. Like I presented earlier, did not have much time to explore. But if you look at the logistics cost, if it's high, how can you compete with other parts, not ASEAN, but other parts of the world? How can Indonesian or how can Vietnamese coffee can compete with Brazil if you go to European market with a very high logistic cost, for example, right? So, and that's the second point I try to raise. The third one is COVID. Because I believe because the size is small, right? So we say M micro and small. The size small, so they kind of lack of technical, the lack of capital. So how can we enhance them in order to deal with the COVID? Because COVID, killed them a lot of resource, right? So how can we have government do it to help them to revitalize and survive? So again, in my point, I agree with every other speaker just now. And I emphasize the three things that we should look into. Number one, again, is the technology. Second, competitiveness, and COVID. So they are the three important points, but they interrelated with each other. So that's from my point of view. Thank you very much for your listening.
Professor Trung, I want to ask one question regarding to this, Prof. Since you are in academicians, what do you think the role of the university to support the SME? Because in my mind, university can play a much role. For example, those of the students who are studying information technology, they can make like simple applications to promote the SME product overseas.
Right. Yep.
Those of the students who study marketing, they can develop the packaging of the product so that it attracts the buyers. And other discipline can also support the SMEs for the digitalizations. How do you see this role of the university towards SMEs?
There's no question about that, right? So I think it's really important. And if you look at the big firms at the moment, Facebook and others, most of them come from university students, right? So Mark Zuckerberg and others, you will see that they actually from the university or even bigger. I don't advocate to drop out the university to run the company, but look, it's all about the university because, you only see one or two people without the formal education that can do a great job. But majority of them start university. No doubt about the role of university. And by that, I mean that, I want to refer to the Bond Global concept. That is a key player in today, because globalization, we have M.Ec, but we also have Bond Global. Bond Global, they can use their special talents, like some sort of technology, like you mentioned, or marketing, or new way of products and innovative service and things. They can reach out. So those people should come from the universities, right? Education. Right. But apart from that, I think, like us here, we can know what is country specific. It's Malaysia, Indonesia, Thailand, Singapore, Vietnam. So we can complement each other. And I think I have no doubt about that. But we should have a collaboration forum like this so that we can connect and see how we can, complement each other in order to be more competitive.
How do you see the global value change in the Southeast Asia towards like European market export, but coming from the SME? Do you think we have strength on that?
We do have strength, but at the same time, a lot of challenges. One of the reason is supporting industry, like I say, they do maintain the competitive. Why they don't go to Brazil and Mexico and China, but they should go to Southeast Asia. So we need to see one of the important like factor condition, like I say, labor supply. Most of the time that in Myanmar, in Vietnam, as now it's more Cambodia and Myanmar with the labor. But more than that, if they produce a car or high-tech product, you know, they have thousands of components. So who going to supply those 1,000 components, right? Because that's the weakness for, even though, you know, it's different from country to another. Singapore doing much better job and Thailand better than others, but like Vietnam and somehow Indonesia and others, it's hard to participate deep and move up the value chains in global value chains. So that's the challenge, but we can overcome. The way China and Brazil, they did different approach, and China was vastly successful compared to American peers like Brazil or Mexico. So if we have the right strategy in place, and we should do the way like China did in the past, but have to look at the environmental issue, look to have at the, you know, transparency and those kind of things will be successful for our ASEAN region. Thank you.
Thank you, Professor Trung. Right now is 9:50 Indonesian time, so I don't think we have more time for question and answer. Once again, I thank to the presenters.
Sorry,
yes?
for before you close
Okay.
to online, I want to conclude first for the input from the Miss Mila and Professor Fatma. Yeah, thank you very much about the help in SME. We will, I think for the policy recommendation, not only in Indonesia, but also in ASEAN, we could propose the importance of health. So economy, currently health is very, very important inputs in economic production process. So I really agree that we should propose that the HSE, health, safety, and environment should be included now in the economy business ecosystem. Yeah, I mean that in SME, how the role of health, safety, and environment is very important input. Yeah, so I really agree with that, and thank you for the input. Thank you very much.
Okay, thank you, Telisa. Mr. Yoong, do I have still time?
We still have 5 minutes for
maybe
the
for
discussion.
the okay.
Yeah.
Good. I'm still following the questions of the role of the IT towards the SMEs. I know that after this, the section of this is with regard to the IT, if I'm not mistaken. So I please any of you who are here who are expert in IT, maybe you have experience in as a practitioners to develop the applications to support the SME, or maybe you are an academicians studying about the application of IT towards the SME. Please share your experience here, or you may ask questions about it or other things. Please. For those of you who are in the IT group, you may share your experience. You may open your mic and then share your view.
I think we have someone raised their hand, and we still have 3 minutes. Yeah.
Okay.
Raditya, if possible, I would just like to ask about
yes,
implications or things related to e-commerce, because I didn't heard like the thing of e-commerce, which I think is very much, it has very big implications for trade facilitation. I wonder if Dr. Telisa has some insights on trade facilitation for e-commerce in the region. Thank you.
Yeah, Dr. Telisa.
Yeah,
e-commerce.
thank you,
Yes.
Mr. Miguel. Yeah, in the second webinar, actually we all has been discussed about e-commerce for SME in ASEAN, especially after ASEAN signed RCEP, Regional Comprehensive Economic Partnership. In that, our new RCEP agreement, there is some for SME SME databases and SME increasing capacity for e-commerce. So Thank you. This is very important issue. You're right. Yeah. If we talk about digitalization of SME, of course, we can discuss for the two big pillar, yeah, e-commerce and fintech. Yeah. I think we need also discuss about the e-commerce policy in each countries in ASEAN, and how SME also collaborate with the Ministry of SME collaborate with the Ministry of Information and Technology and other ministry that relevant. So I mean that how there is a competition, but also there is a cooperation. So how to be balancing? Because in e-commerce, of course, there would be cross-border trade, right? So cross-border trade between countries, yeah, sometimes, for example, from China, yeah, for example, in Indonesia, for example, there are many e-commerce from China that difficultly challenging, yeah, because of this. So how ASEAN regulators can make the agreement about how the rule, yeah. So we want our SME is internationalized, but there is also this protection, yeah, in terms of whether they are in the same level of playing fields, yeah, whether they have the access to technology, because there are still the technological gap between each member of ASEAN itself. So how we can discuss about this. So Mr. Miguel, thank you very much. The topics about e-commerce already we also discussed in the second webinar at this time, but currently we are not focusing more on the e-commerce. But of course, the digitalization issue as the part of the adjustment of the SME to this new normal is very, very important. Thank you very much, Mr. Maybe we can discuss more on that issues, yeah, about the e-commerce in ASEAN, maybe in the next webinar or in the next discussion. Thank you very much. Thank you, Professor Raditya.
Thank you, Ibu Telisa. So right now it's 9:55 Indonesian time. Mr. Yoong, I believe it is a time for the result report on the online survey. So I hand over to the Ibu Shochrul to make a report on this result of the online survey. Ibu Shochrul, are you with us?
Thank you, Doctor.
Are you with us, Ibu Shochrul?
Yes, Professor Raditya.
So the time is yours, Bu Shochrul.
Okay, thank you. Can I share this screen? Sorry, okay. Okay. Thank you, ladies and gentlemen. I'm Rohmatul Ajija from Universitas Airlangga. Now, I would like to present about the online questionnaire result about the ASEAN SME internalization policy in harmonization in the new normal era. The lead researcher is Bu Telisa, and the research team, Professor Raditya Sukmana, Professor Trung, Dr. Nisful Laila, and also me, Rohmatul Ajija. So we have 9 questions for the questionnaire. First, about the main factor to increase the ASEAN SME internationalization and competitiveness. Most of the respondents, around 62%, they answered the technology and innovation, integration to global value chain, quality standard, use of e-commerce, and the last one is about the interpreter skill. Okay, the second question about the importance of health certificate to include the quality standard for SME internationalization after COVID-19. Most of the respondents answer yes, around 97%. The reason was because after pandemic, we cannot go back 100% like before. Therefore, it is important to keep track of people's health condition wherever they are. With having health certificate, we can prevent things like this pandemic to not happen again in the future. And the second reason, actually there are so many reasons, but I summarize into two because the similarity, because during this pandemic and even after the pandemic, many people and sectors are very concerned about the health problems, and it becomes a quality standard of any sector, including SME. The respondents who answered no, only 3%. The reason is because after COVID-19, health certificate is not important for quality standard. Only the certificate of COVID-19 vaccination is matter right now, because health certificate cannot make sure that you are safe from COVID-19 unless you have already had the vaccination. And the last reason is because there will no more pandemic in the future. Okay, the third question is about the SME policy response during the COVID-19. The most of respondents answer about the loan restructuring and financial access, around 45%. And then the second one is about the wage subsidy. Third one, make access or sales support. And the last one is reskilling and or training for the worker. For the fourth questions about SME should get the main priority in each Asian member economic recovery program. Most of them agree. 97% of the respondents agree that about this statement. The reasons are because all countries are affected by COVID-19 pandemic. Thus, economic recovery program is important, especially for developing countries, because SME have an important role in national economic growth and contributes to the total national GDP. And the last one is because COVID-19 is breaking all of the economic stuff at each Asian country. Some successfully rises and get normal, while some is still struggling. SME will be a great ecosystem to share and help each other. And the respondents who answered disagree is around 3%. The reasons are SMEs are affected by the pandemic. However, they are not the most disadvantaged one. Therefore, we should prioritize the disadvantaged ones, such as the disabled people, people with financial difficulties, laborers, etc. first. The health promotion should be the main priority, and the last one is because they are another aspect to achieve economic recovery, not only SME. Okay, the fifth question is about our university could become valuable partner for SME internationalization in ASEAN, especially in the area of the research and innovation. Most of the respondents answer agree. Only 1% of the respondents answer disagree. They disagree because a lot of innovation begin from the university, and this is for the agree one, a lot of innovation begin in university. As the agent of education, university can become a valuable partner for SME because university is a place where innovation and creativity begins. Individuals take their first professionalism from the university, which offers the highest role of the university in providing and preparing the individual for future aspects. The one who answer disagree, the reason is because university could become a partner for SME internationalization, but not so significant because this issue is about the international relations, and as for some country who strictly under government might not be able to play that role comfortably. Okay, the sixth question is about SME is ASEAN could collaborate in Asian capacity building for digitalization and R&D. 98% the respondents answer agree because collaboration is very important during these crisis situations because SMEs must be stronger together to survive the competitive market, expand their business, and increase their quality. The second one, because the digitalization plays a significant role during the pandemic, as the Asian citizens are adapted to digitalizations more and more every day. So that promoting SME through digital platform can a great solution. And the last reason is because we can learn the different aspects of different countries and share and exchange the new and innovative ideas for the better sector improvement. The one who answered disagrees only 2%, and the reason is because the lack of technology and awareness in many areas in every country. Okay, the seventh question is about ASEAN member need to increase global value chain, especially after COVID, that need more regional GVC participation. Most of the respondents, around 95%, agree about this statement, and the reasons are because ASEAN members have its own potential and strength on different areas of production. By increasing regional GVC participation, each country's economy may progress faster. Because the COVID outbreak, many countries suffer economic problems, and because it can provide more jobs to people, especially after recovery of COVID-19, and it looks lively for SME. The one who answered disagree is only 5%, and the reason is because GVC forms an entire ecosystem and a multi-level supplier network. Therefore, some countries may not ready to such a big change due to the difference of the impact from the pandemic, which will take some time to adapt.
Okay, sorry to interrupt. We still have 2 minutes. Thank you.
Okay, thank you, Mr. Yoong. Okay, the equation about the ASEAN need collaboration in SME financing. What is the form of collaboration? Funded, expertise, transfer agreement, education, technology and development of economics, capital loan service and easy financial access, Asian common banking system, cooperation in the form of SME products, transfer of science and marketing skill that can increase selling value. Collaborations need to start with smaller units and gradually approaching to larger ones to achieve a systematic and orderly transformation. And about the microfinance sector, providing fund and exchange program. Okay, the last question. 2, ASEAN need harmonization on trade measures after COVID-19. The most respondents answer yes, 98%, because ASEAN will need to optimize the role of trade in post-pandemic economy recovery, leverage on digital technologies to boost trade, take more proactive role in the reform of the global trading system, because every ASEAN member needs to take a part in recovering after COVID-19. Export-import trading inside ASEAN will be agreed to support, helping each other with all sources is the concern during and after pandemic. And the respondent who answered no, the reason is because especially for export restrictions and removal of tariff, and because it is balanced already, but need to higher the quality of standard. Okay, thanks. This is all my presentation and the result of the online questionnaire. Thank you.
Terima kasih. Thank you very much. Thank you very much for our second speaker, Associate Professor Dr. Telisa, our moderator, Professor Dr. Raditya, and presenter, Associate Professor Trung and Ms. Shochrul. I would like to remind you that tomorrow we have a cultural performance from 10 countries. There are 12 awards will be given and door prize, including the Zoom invite, and 50 participants from all university contributing performance and all committees and all presenter and non-presenter. Let us ride along the way and continue our third discussions topic today. I'm sure ever since the pandemic started until now, many of us are curious about this title. But first, I would like to introduce you the presenter, the moderator, and also the speaker for our third topic. The presenter of our session is Dr. Muhammad Alif Muhammad Puzi. He is currently a senior lecturer at the Urban and Regional Planning, Faculty of Built Environment and Surveying, University Technology Malaysia. He holds a PhD in Urban Regional Planning with research experiences in tourism planning, tourism business, tourism economics, urban economics, and entrepreneurship. These sessions will be moderated by Associate Professor Dr. Awangku Hasanah Bahar, who is currently the head of tourism management programs at Faculty of Business, Economics, and Accountancy. And he is also a associate professor at University of Malaysia, Sabah. He holds a PhD in tourism management from Victoria University of Wellington. His experience with the topic as the founding director for Eco-Campus Management Center of UMS from 2013 until 2015. And he was the head of BIMP EAGA unit for tourism development from 2012 until 2013. He is the founder and the current editor-in-chief for both BIMP EAGA Journal for Sustainable Tourism Development and Journal for BIMP EAGA Regional Development. Now, I would like to introduce you our speaker for these sessions, Town Planner Dr. Nurhaliza Halim. She is the head of Tourism Planning Research Group in University Technology Malaysia and the Program Coordinator, Master of Science, Tourism Planning in University Technology Malaysia. She holds a PhD in Tourism Management from University of Tasmania from Australia. Her experience is related to the topic as a research expert in sustainable tourism development, ecotourism, rural and community tourism, smart tourism, tourism demand, and etc. Furthermore, she is the tourism consultant in special area development, policy review, strategic planning, regional development plan, and etc. Ladies and gentlemen, are you ready for this session? The third topic, ASEAN Tourism Digital Zoning Guideline for Smart Traveling Networks. Dr. Nurhaliza, the floor is yours.
Thank you so much, Mr. Yoong, the Master of Ceremony for today. And of course, my gratitude to the ITTP-COVID19 Secretariat for once again invited me as the speaker for this topic itself, and as well as for the chairman of the working group for the ITTP-COVID19 in discussing the ASEAN Tourism Digital Zoning Guideline for the purpose of the tourism recovery plan for ASEAN countries. So without further ado, give me about 2 minutes to share my screen to everyone and share my my views, and as well as the working group discussion for the group.
Mr. Akmal, please stop sharing the screen. Yeah, thank you.
Hold on a second. Is everyone can see the screen now?
Yes, Doctor, we can see the screen.
All right, thank you so much. All right, let me introduce to everyone about let me relate to the first discussion panels, and as well as the second discussion panels, which I think so much so related to what I'm going to discuss further in this panelist sessions, whereby in the first working panel discussion has been mentioned about the how the health and travel certificates is very much important for the tourists to start their engine to go and for their journey in any tourism destinations. And when it comes to the tourism operator, the preparedness or the readiness of the tourism operator to make sure that they are ready to receive the tourists. So it's very much important, and this has been highlighted in the working group, second working group panelist discussion just now, where most of the tourism industry or the tourism related operators are from the from the tourism related businesses, and they are from the SMEs. So let's go back to the new norm of tourists. So when if we put on our hat with as the tourist hat, then we start to think that now is the travel restrictions and the entry requirements from the country is very much restricted, and it's become one of endemic, or it's one of the restrictions for us to as a tourist to go travel. And we started to have this mindfulness fear to travel, and it will affect it in terms of the decision making, whether the pre, during, and post visitations preparations, what we're supposed to prepare, and what's we supposed to get advice from whom that we can get the advice with. And because of that, the safety and security become more priority to the tourists. So the COVID-19 has changed a lot in terms of the travel preference and as well as the destination's readiness. So as I already quote from the previous panel discussions, one of the concern is about the tourist or the traveler travel confidence. And then it comes to the tourism related businesses, readiness operations. And of course, the third one is where we can go, how safe we are in that particular destination. So the lack of real-time determinations of free COVID zone area, and as well as the country-to-country tourism policy related to tourism zoning becomes into the picture, where we come up with a needs of the digital tourism zoning network for the safe travel corridor destinations. So ASEAN tourism policies, there are lots of being discussed in ASEAN countries, and ASEAN itself, have come out with the comprehensive recovery framework, where there are three priorities area that become the shooting angles to the all ASEAN countries, where they in the document itself mentioned that the road to recovery, the towards ASEAN as a single tourism destination, as well as to rely on the sustainable, inclusive, and as well as the resilient tourism development. So because of this, the main challenge to the ASEAN tourism related policies, as well as to the tourism roadmap, recovery roadmap, is to identify and as well as to get the public acceptance in terms of the safe tourism zone. So as you probably everyone can see, there's a lots of documentation measure that been approached. So we summarize on the tourism ecosystem disruptions, and as well as how to build the confidence between the supply side and as well as the demand side. So at the end of the day, it will become the ASEAN digital tourism zoning parameters. So this will become in the next agenda of our working group, and as well as in this panel discussion to be discussed further with all the other stakeholders as well as the other working group members in terms of the supply side shock and as well as the demand side shock. All right. So as what we already discussed from right from the beginning, and as well as until up to the third panel discussions, we have one single common similarity, which means the digitization is equally important as vaccination. So I quote here COVID as the vaccination for the digitalization, and of course for the tourism zoning, which is a C for the confidence, O for the orderliness, V for the visualizations, I for the integration, and of course the D is the domestications, to tap into all the tourism domestic and as well as the market resources share within the safe tourism zoning corridor. All right, so tourism zoning policy parameters. The working groups come out and discuss 5 ASEAN countries has been identified, the tourism zoning related approach or the tourism zoning related policy that been discussed upon in the aspects of tourism zoning. So among the aspects that been discussed is the COVID-19 hotspot zone identifications, vaccination status and herd immunity zone, quarantine procedure and zone, travel bubble area zone, travel restrictions area, standard operation procedures, tourism in the tourism operators. We also have destination risk management being discussed in the many of the tourism policy. We have also tourism digital marketing and promotion tools, how the tourism zoning, how the tourism destination will bring out the creative and innovation ideas. We have also related facilities and infrastructure being discussed in the tourism policy recovery plan, as well as the environmental quality. And of course, the last but not least is the limits of acceptable change in the destination, whereby how many people that would like to accept or the destination will going to bear for every time visitation by the tourists. So whether or not we're going to have a control crowd in a certain time and a certain area. So with that, we conclude, okay, the working group conclude, and as well as come out with a similarity from each of the countries. And for this, ASEAN tourism digital zoning parameters come into the picture with the 3 different objectives, which is one of the objectives is to identify and to the possible parameters for the ASEAN tourism zoning framework in new norm traveling preference, which we want to have the tourist decision making and also the destination preparedness. And this probably will be covered by the first working group. To harmonize related tourism policies in ASEAN countries to support the tourism zoning guideline. And this pretty much related with the second working group discussions, which how prepare and how ready the tourism operator to be reopening, to recover, and also as well as lastly to resilience in the industry. And then of course the third objective is to recommend the ASEAN digital tourism zoning, which networks that for the safe tourism corridor, and this will be the risk informed tourism planning tools for the traveler journey, and as well as the real-time information for the tourism zoning. So there are 7 parameters altogether, which we come up with the very solid framework. This framework once comes to the 3 phase of the process, which is the first process or the first phase of it is the traveler entry and health clearance. So once that been extracted, then we have the second data, which is the herd immunity zone and as well as the COVID-19 hotspot zone. Then with that 3 different data, we go to the second layer of the process, deciding the tourism zoning, whereby we look into the tourism destination policy and performance in the 6 different aspects, which is the digital and virtual usefulness, law enforcement on SOP, facilities and environment management, tourist experience activities, safe travel corridor, and as well as destination carrying capacity. So the criteria have been layered, and then we look into the weightage index, because each country have a different weightage index, of course, that's been discussed in the previous webinar and also in the previous panel discussion as well, whereby at the end, the third layer or the third phase of the process is to create the green mapping, to create mapping for the green zone network, as well as the COVID-19 safe tourism zone, zone star, which comply to the health zone as well. Okay, so the 7 parameters is COVID-19 records, vaccination status, digital and virtual tools, SOP enforcement, facilities, environmental quality, buffer zone and safe travel corridor, and as well as the destination carrying capacity. All right, so with the 5 different zoning, okay, we come up with the 5 different zoning with a 5 different colors. And of course, the best color that we would like to see in any tourism zoning is the blue color, which is the zero COVID. In real-time data, herd immunity has been achieved of the herd immunity, receive all the facilities support, receive included in the buffer zone and as well as the corridor as well. But let's go back to the real situations. We are looking at least the green zone, because no doubt we're going to see, we would like to see this tourism zoning in a green area. So at least when it comes to the green networks or the green area, green tourism zoning, then everybody can also start to start traveling and plan their traveling for now. Okay, so we look into the to the green color. So the green color at least to the COVID-19 cases in 15 days is less than 10, or 70 to 90 been achieved in the vaccinations herd immunity. And of course, in terms of the facilities, is very good. In terms of the digitalization, is very good, and so on and so forth. So we bring out, okay, so we bring out the solutions. How are we going to map this? How we want to identify? Everyone can know the green zone, or basically the network, which zoning, which tourism spots has been clear for the visitation, to help the traveler to make their pre-decisions before they start their visitation or before they start their journey. So we come up with this ASEAN Digital Zone to go to the ASEAN Green Zone Smart Traveler Network. All right, so we start off with the zoning that been identified by the mapping parameters just now. And then once the zone A and zone B clear to go or been green, okay, appear as a green, then the tourists can travel from one green zone to another green zone. So this is what the concept of the Green Zone Smart Traveling Network. And of course, the right from the beginning, the most important part is the data security, and as well as the data, the network itself, so that it's been similar by one country to another country. All right. So we prepare a map. Okay, so this is the concept map. Okay, the concept mapping on the tourism digital zoning network. So probably the travel bubble will become the first pilot destination for all ASEAN destinations, for all ASEAN countries. So the pilot destinations, we identify a few. Okay, so like for examples, we have Phuket that been opened up for as the travel bubble in Thailand. And Langkawi in Malaysia has been identified, but however, until now, Langkawi has been hasn't opened up the tourism zone to be to free for the tourists to free to go travel to Langkawi. So looks at the current situation. So this will be look like of the green zone traveling, the digital mapping, which is we will provide real time. Okay, so the stakeholders or the industry or the developer will provide the real time data, and then look into the overall pictures of the parameter, and then it will summarize into which color zoning that area will be, that particular destination hotspot will be. So for example, this one, I provide Phuket with the yellow zone and so on. So this is the detail for each of the area that we pilot with. So this is the interface will look like. Okay, the focus area with the health check, COVID-19 cases, vaccination cases, the quality of the infrastructure. However, we also put out okay, for the tourists to be to decide the limited access to Phuket. So this will become the pilot, can be proposed as the pilot tourism zoning, which considering the health, not just the physical elements, but as well as the health considerations, and also the tourism operator preparedness, readiness. All right, so this framework also become the, we throw the questions to the public opinions to see how the public receive and respond to what we already being developed so far. So this is what we get from the previous webinar. And I think Dr. Alif, after this, will also continue to read and also to present the result from the so far, the detail of the public opinion. All right, so we have 348 response from the previous webinar from 10 ASEAN countries. We have from the government, industry, and students. We also have the respondents from 20 years old until 50 years old, which is, this is the target market segment from the all over the world, the tourist market segment in general. So what we received, the first question is importance in tourism destination selections, whereby if you look into my purple color framework is the first one is the health safety procedure. The second one is the COVID-19 statistics, and the third one is the country's crisis situations. However, there are also important factor, which is in terms of the food carbon, in terms of the tourist limit, also become the indicator for them to select the tourism destinations. And then when it comes to the tourism operator readiness, based on the recovery phases, we look into the third criteria, which is on the product enhancement. So meaning to say the product enhancements become the most important in terms of the medium phase to make sure that they are ready to receive the tourists as well as they are ready to operate their business again. However, in the short phase is the safety procedure. So it becomes to the number 3 main solution, or the main opinion, the main outcome from the presentation or from the output is the which tourism spot that can be the pilot tourism zoning destination. So more than 50% mentioned that as the pilot destination, the tourism zoning should consider island with an airport. So that's why we have each country in ASEAN propose Langkawi, propose Phuket, propose Bali as one of their pilot destination for the tourism zoning. So that will conclude also. So these are my questions that will also being discussed by our moderator after this. Last but not least, my conclusions to everyone here to think and also to further discuss on how to strengthen the resilience of the tourism industry require enhancing the destination capacity, and also to reduce the destination vulnerability in terms of the manage the tourism shock, and of course establishing the ASEAN zone traveling network as one of the free zone or safe zone for the traveling. To ensure that tourists can travel without any limitations or without considering the negative impact. Of course, in terms of the decision making, this will be one of the sections that we'll need to discuss further. So without, I think that's all from my part, Mr. Yoong. I think for this time around, we would like to see and we would like to discuss further with all the other panelists, members, as well as the public opinions on how we want to improve the tourism zoning. Because of course, everybody been waiting when we should start our engine and when we should start our plan to go and see the world. Thank you so much.
Thank you so much, Dr. Nurhaliza. And now I would like to invite Associate Professor Dr. Awangku Hasana Bahar to moderate for the discussions part. Welcome.
Okay. Thank you very much, Mr. Yoong. Again, thank you very much to our speaker just now, Dr. Nurhaliza Halim, for the overview of the ASEAN Tourism Digital Zoning Guide for Smart Traveling Network. And I think that based on this group, there have been a lot of discussions on, I remembered all of those meetings that trying to come up with the parameters and trying to make sure that, all those things are correct in a way that, of course, doing a lot of surveys, actually trying to make sure that all these parameters are actually quite very what do you call that, useful in developing the zones. So I think for these sessions, we're trying to get some of these what do you call that, some assistance from the others as well in giving us a feedback, or also again giving their opinion about the presentation just now. So I think on the screen you have, these are the things that probably the group needed for you to give a feedback. For example, number 1 would be the challenges and prospect to harmonize the digital tourism zoning, because this is again in the ASEAN or in the regional context. Maybe if you have any feedback on the parameters as well. Currently, we have 7 parameters. Okay, but then again, if you have something a bit more, I think something's different, we would like to hear that. And of course, the others would be like something about weightage index assessment, also risk benefit contributors as well. So this will be help in terms of developing this idea on ASEAN tourism digital zoning. So I would like to open the floor for any feedback or questions to the speaker.
Sorry, can I give the...
Yes, please, Dr. Telisa.
Yeah, thank you, Dr. Hasanal, and thank you for Dr. Hasliza for a very nice presentation. I just want to respond about maybe about the challenges and prospect, and also want to respond and give also the feedback. For the digital tourism zoning guidelines, I just want to ask how dynamic, this digital tourism zoning. I mean that sometimes because of the virus development currently is very, very dynamic. I mean that how fast that we could adjust the digital tourism zoning guidelines. I mean, sometimes currently in one country to other country, how fast this could be changes. For example, maybe one region in Indonesia, for example, or in Malaysia, for example, it is said that this is a green zoning, so we are safe to go there. But after that, maybe it could be changes. At maybe in one day it could be changed. So we have the plan to go there, but after that, maybe there are some changes that very fast. That this is before the zone is green, and after that maybe it's become orange. So we cancel that. And I mean the technical things. How we could. I mean that how we anticipate the virus development itself with the tourism zoning guideline itself. So I think this is one challenge that's very important for us. And the second one, different regulation environment in each ASEAN countries. I think there are the same or similar response of ASEAN countries in terms of tourism or health or economic. But there are also specific things in each countries that may be different. I mean that how we could harmonize the difference in each ASEAN members. Because, for example, the ASEAN capacity of health is very, very different in ASEAN, for example. So how about the countries that maybe they are good in their tourism, but still low in the health capacity? So between each indicator, balancing between each indicator, how we could also solve this solution. Because in ASEAN itself, there are a Singapore that has very high standard, but in the other one, maybe other emergings that still have to fight with several issues. So how we can narrowing the gaps that already existing, maybe in health, in economy, tourism industry, and also in the data security. That's 2 points. Thank you very much.
Okay, thank you, Dr. Telisa. Before I actually let Dr. Hasliza to answer, if you guys don't mind, I would really like the first part of the questions. I think it's very important. It's very interesting actually, because I think COVID actually has changed the way we have a lead time to decide on our holiday. I think that for the last 2 years, the last 1.5 years basically, if we waited like for 6 weeks or like to decide for holiday, it will not happen, because the zone keep changing, the situation of the COVID keep changing as well. So I think most of the time that I know that people, they usually have a shorter lead time, like 3 days or 1 week, like that, to go on holiday. So I think the dynamics of the zoning is actually quite interesting here also. And of course, I actually have never really explored the options of the facilities different in the different destinations. So this one I would like to interested to hear from what Dr. Hasliza will say about that. So Dr. Hasliza, if you have anything that you can reply on that.
But thank you, Dr. Hassanal. Yeah, I share the opinion with you. Which COVID-19 become another situation, so another factors for the tourists to start to travel. So because of the scared of the place, because of the fear itself, inner fear and also the outside fear. And of course, to respond to what Dr. Telisa has been raised out in terms of the challenge. Yes, that's the main challenge, Dr. Telisa. I agree. I cannot agree more about that. Okay, but however, we discussed. I think we discussed this almost over 2 weeks time with. More than 5 times been arguing among ourselves about how we want to harmonize the tourism policy zoning to become one similarity for the ASEAN countries, and also how the record can be as accurate as itself, as accurate as it is to give confidence to the tourists. But again, I would like to quote what I think in our first panelist discussions has been mentioned about there is no zero risk during traveling. I cannot agree more, and I would like to quote again to echo against what Dr. Aulia has been discussed in the first presentations. There is no zero risk during traveling. So without no doubt, we have to take the risk. So if you are as the traveler, as the tourist, and without even without COVID-19, you always have has this risk to travel. So in terms of the records of the COVID-19, as far as the working committee been concerned that each country have their own records. Probably in 14 days and so on. So we left that to the health Ministry of Health to consider in each country to look into how accurate the data that can be presented to the tourists in real times. And of course, if I can see in Malaysia cases, okay, so I can see from the records in 14 days or in up until 7 days. So might be for now we cannot plan ahead a year ahead, but we can plan at least 1 month ahead or at least 2 weeks ahead. And of course, in terms of the procedure, entrance requirement, entrance clearance, it's be very different country to country, and this will give the country some negotiable conditions on how they're going to prepare their tourism zoning by each country. So meaning to say, once we arrive to that particular country, then we're going to adapt into their red color zoning. Of course, I take into the considerations you're mentioning just now about the difference between one ASEAN countries to another ASEAN countries, or probably in the regional context, in global context as well. Okay, there are so many differences because of the country's regulations, law and regulations. So without looking at the difficulty, we as the tourism planners or the tourists itself, ourselves have to harmonize with the each country zoning. It's just that probably as a one framework that we can agree as the ASEAN tourism zoning framework is to put into the consideration all these parameters. But of course, this need to be discussed further with all the stakeholders involved that going to develop the framework, and as well as going to develop the guideline itself. So thank you so much, Dr. Telisa.
Thank you, Dr. Telisa, for that wonderful questions. Okay, so do we have any other feedback or any other questions from anybody else, from other panels or from other groups? I think Dr. Hazliza, just to basically to it kind of reminds me, remember the second question is all about like health facilities, how we want to make sure that everything is going to be like meet the expectations of different countries. And it kind of like resonates to what we're doing at the university anyway with our international students. So our international students, what we have done basically, we do actually give them a bit of a difference in terms of accommodations, and also health facilities and so on. So I would say that there must be kind of like a minimum standard of the kind of facilities that that the international students will actually have, will be satisfied or will be like contented to. And I think this is something probably a tourism also that we can see from that perspective as well. There would be some kind of a minimal or acceptable standard, international at least, you know. So this kind of like resonates what we are doing at this at the university as well. Okay, anybody else that probably want to ask maybe about the weightage index assessment or its benefit? But if you have anything that, you know, beyond these kind of questions, I think we will welcome that as well.
Yeah, related to the students traveling just now that you mentioned. If I can remember, the among the first group that been allowed to travel international is first is the students, second is the expatriates, the business expatriates, and as well as the third one, patients, okay, in the health situation. So basically in tourism industry, we allow these three main groups of people to start travel internationally, as long as they have formal letters to accept them from the countries and so on. However, in terms of the general traveler, is until now has been limited to any countries, but now soon, if I'm not mistaken, there's a few countries already open up the borders and receive the tourists already, as long as they receive the 2 doses of the vaccinations with the formal invitations, and as well as the PCR tests to complete the procedure.
Right. Thank you, Dr. Aslita. That reminds me of what do you call that, of a traveling in the really old days before. Like when you want to apply for visa, you have to get a lot of the documentations, and you have to go to do a lot of vaccinations as well before to go to certain countries as well. So I think in the really old days that actually these are necessary, but obviously travel has been very much simplified before COVID-19, so everything is very easy. But nowadays we can see that basically it's coming back to that mode again. So of course everybody, I think anybody will not like to go backwards, you know. So that is actually quite but it's actually quite interesting to see how this trend's coming back. All right, so we still don't have any hands raised up and things like that. So
sorry, Dr. Hasanov.
Yes,
if
Dr.
there
Telisa.
are no other question, maybe I can give one more. I forget about one things here.
Okay, sure.
Yeah. Until we also wait for other response. Yeah. For number 3, yeah, about I interested here about the weighted of index assessment, usually because are usually interesting in the methodology. My experience when we composing the index or create the index, yeah, there are some choices, yeah, whether we could equal weight or different weight. So I agree that maybe not equal weight but different weight. For example, health, of course, currently number 1, yeah, as the most significant things in this index, I think. So I just do the suggestion that maybe we can do like the analytical hierarchical process methodology with expert judgment. So, but this is representing all ASEAN members. So we can do some discussion with the ASEAN stakeholders, including governments and also private sectors, yeah, and also maybe from the academics and practice related, and then we can ask the the weighted, each stakeholder could send their weighted, how numbers they weight, and then after that maybe we can get the average of the weighted about this. So I think this is relatively fair, that representing also the expert judgment here, of how we could make the weighting here. So I don't know, maybe I missed about the 9 parameters you mentioned, that maybe this is can you show me the 9 parameters, for example?
Is that the one that you're looking for?
Okay.
Or?
Yeah.
I think the weightage is shows in the white color zone, the white color parameter. So with the different, so we try to get as similar as possible from each country. So we discussed among the 5 representatives of the ASEAN countries. So this is what we conclude so far. In terms of what should be in the each of the color coding zone. So I think it will translate it differently. Depends on the where you come from, and as well as which business operator and which community you are. So this will give a different understanding as well.
I think it's very, very currently as the good initiate start. I mean that I see that this is a very comprehensive, and you also do like what I think about the doing the expert judgment weighting. That through the analytical, usually using happy method. For getting the weight for each indicators, but maybe I don't know whether this would be this has been applied or still in the process to be applied. I mean that this is already has become the practice, or still the recommendation.
Still under recommendation, whereby we are preparing the framework for now, and of course Cambodia, one of the country that giving the positive acceptance to make sure that this research going to be promoted into the ASEAN recovery plans soon, and I would consider this as our kickoff, or as our started conceptual framework to include all the members of the working group to look into very details of each of the parameters, which also will include not just about the tourism in industry, as well as the health and the SMEs, and soon will be our next presenter, and our next panel discussions will be on the data security. So that will complete everything, and hoping that this will give a framework to the tourism ASEAN tourism recovery framework as part of their policy as well to be considered.
Okay, thank you. Thank you very much. I think this has been a good one. Just concerned about discussing about the methodology to have the weight, and maybe about the parameter. I don't know whether maybe there will be an input from other working groups or other participants about the parameters. I think, but the parameter I think has been good and complete. Representing all should be. Maybe we can get the input from other participants. Thank you very much.
Thank you, Dr. Telisa. Definitely, when you talk about parameters, and it's always based on the perceptions, and the perception is a very dynamic thing. So I think it should be consistently reevaluated, which one is more important than the others, because it will change. So definitely, I think to get the most probably solid ones, at least for a certain amount of time that's workable, I think would be great. And I just hope that other groups as well can channel some feedback on the parameters also, because definitely we will not take it as a final kind of product, so that kind of thing. Thank you, Dr. Telisa, and thank you, Dr. Hasliza. So anybody else that has any interesting feedback or experiences, or maybe some kind of questions, regarding on the digital tourism zoning? I think otherwise I will be having a solo conversation with Dr. Hasliza only.
Yeah, I received one opinion from, I think, from Dr. Nikwa from the chat room.
Okay.
Looking forward, Dr. Nikwa, for the medical tourism. Of course, medical tourism actually on the second phase of the category that's going to be a sub letter. Even for now on also is the medical tourism. So as long as you are receiving any treatments from the ASEAN countries, you are giving the priority to travel. But of course, in terms of the one transit only, which is only from the host country to another host country to your destination country. So that's for now that's the plan. The travel plan been decided by the countries, I think. However, as far as we concerned, as the working groups, each countries have their law and also the regulations in terms of the traveling inbound or the traveling within the country itself, within the destination with a certain days and also a certain staging points, one point to another point. So that's the main idea of this traveling network, so that you are safe to travel in one country with the applications that we plan, and as well as the mapping framework that we recommend, so that within the country you can safely travel one zone to another zone.
Okay. Well, Dr. Hasliza, that when you're mentioning, and Dr. Nikwa as well, when you guys mentioning about medical tourism, Russia is actually opening up the country for people who wants to have a vaccinations, because in some other countries the vaccination may be a bit too long to wait. I'm not very sure why, but they do open up for vaccinations as well. Can you see this happening in ASEAN countries, Dr. Hasliza?
I think there's a few countries, but I cannot give specific names of the countries that's allowing vaccination to be done for the other countries' residents. But if I'm not mistaken, as far as all the destination has been achieved, the herd immunity, I think the best person that we can ask is from our panels, from the first working group.
Okay. Right. So
I received one
okay.
question actually personally. I received one question personally related to based on the parameters highlighted. Okay, so this the participants asked, based on the parameter highlighted, how we can identify the tourist green zone if the cases increase and in the same time the number of the people vaccinated also increase. I think the question is quite similar with Dr. Telisa concern right from the beginning just now. The challenge of this tourism zoning is the first one, the main priority is the safe and security. So we have to admit that the data security and also how precise the data that's going to be received by all people can be useful to the user. So meaning to say, we as the tourists and we as the public, probably we cannot put on there's always be the risk for us to make sure that, but again it is up to us to allow this green zone framework to be activated, and let's see how success
or how the result going to be soon. That's my response to that.
Okay.
Thank you.
We still have about 3 minutes left. So is there any other questions from the chat box or online, Dr. Hasliza? It seems more popular that way in your case. Or anybody wants to ask something, the last questions perhaps, from the group. Especially if you want to tie into the other groups as well, group number 1 and 2. Okay, if there's none from the chat box or none from that, maybe I can just ask, because we have done on the questions for discussion, the challenges and prospect parameters and the weightage index assessment. So we haven't really touched about the risk benefit contributors. What would you hope, Dr. Hasliza, that the topic of the risk benefit contributors can actually strengthen the digital tourism zoning?
All right. The digital tourism zoning. Basically, when we discuss about the tourism zoning itself, first of all, one of our understanding about tourism zoning is always about the physical contributor, physical indicator. We never see beyond physical contributor, except ones probably economic can be one of the indicator, but we never look into the cleanliness. We never look into the environmental. We never look into the quality of the infrastructure in terms of the tourism zoning itself. So it's going to be challenging to the industry to apply this digital tourism zoning networks, or the digital tourism zoning, because how much the data are going to be provided by all the stakeholders. So that's the main challenge that I can see so far in applying or in implementing this framework itself. So basically, the try and error can be a way of looking at the risk and also to look into the prospects, not just the within the small area, but look into the global aspects, which we can have. There's a lots of development approach that been highlighted about the sustainability, how the sustainability how the tourism has to look into the SDG, and this much more related to the resilience of the business operator, the resilience of the SMEs, resilience of the tourist itself to become more sustainable tourists in their manner. So this will. I think that's my last view on how soon and how successful this digital tourism zoning can be applicable later. So let's hope that maybe 1 or 2 countries, or maybe a few countries in ASEAN can become the area, okay, the priority to start off the tourism zoning, and look into and like see how the other ASEAN countries can be applied, and after this it will become the global, can be used as a global framework as well, because we've seen Europe already have the green zone traveling network as well, which is, I think, if I'm not mistaken, the first panel discussion also discussed about the green certificates, health certificates. So they also have the green zone traveling network for the tourism zoning. So they work side by side. They provide the green health certificates, and as also they provide the green zone traveling network. So that's the idea of this.
To interrupt, the time is up for the discussion. Thank you.
Yeah, thank you, Mr. Yoong. Yeah, so that's the idea of the overall idea. So we have the green health certificates, and we have the tourism SME to be ready for the internalizations, and of course the tourism zoning green zone area for the traveling.
All right, thank you very much, Dr. Hasliza. I think it's right on the money there. So I will hand it back this session to the MC, Mr. Yoong. Thank you very much. And thank you everybody for participating in this moderating session. Thank you.
Thank you, Associate Professor Dr. Awangku. And also thank you, Dr. Nurhaliza. Now I would like to invite the presenter for this sessions, Dr. Muhammad Alif Muhammad Puzi, to present the online survey result. Dr. Muhammad Alif, the floor is yours.
Okay. Can you hear me?
A little bit lagging, but we can hear you. Hello, Dr. Muhammad Alif, are you still there? I think the host need to stop sharing, so Dr. Alif can share the screen. Yeah.
Yeah. Sorry.
I think the connection is having a problem with you, Dr. Alif. Can anyone help Dr. Alif to share his screen? I think we lost you, Dr. Alif. Person in charge for topic 3, can you share the slide for the online survey?
Okay, wait.
Hello? Okay.
Yes, Dr. Alif, we are sharing your online survey result, and later on you can present.
Okay. So
just a moment. Thank you.
Okay, I already shared the screen. Is it okay?
We still can't view your screen yet. Yep, now the screen is on. Okay. We can see you. Okay. Thank you.
So, sorry for the technical problems. So, for the survey, we already got 200 respondents. So, the main important that I want to highlight from this survey is the first is the tourism destination or tourism related business. So, what should be the suppliers sector need to do? So first for the short phase, I think for the short phase will be the health, safety, security, cleanliness facilities just to provide for the tourists. And then what I want really to highlight is in the medium phase. So what each country in ASEAN do is to revive domestic tourism demand first, just as a catalyst before we wait for the international traveling. So that's the first. And then for the following tourism zoning pre-assessment parameter, all of it, people, respondents always want to highlight on the healthy, safety, security, and cleanliness facilities, and the case record and the vaccination status of each country or destinations. Okay, and then for the ASEAN tourism zoning framework, there's a three of it. So the highest will be the tourism bubble, which means what responder want is they want to have tourism bubble or travel between safe countries. That's the highest importance. And then tourism pilot destination area. So where is the test area? Is it an island? Is it in reserve forest? Okay. And then which of the following economic attributes that should be incorporated? Okay, the highest will be the COVID-19 tourist insurance. So means that the traveler and the government sharing the cost for the cleanliness, safety and healthy facilities. And then the second highest will be the tax relief or reduction to promote the tourism and promote the spending, tourist spending. Okay, and then there's also tourism spending incentive for tourists and for the supplier also to make sure that the price will be very attractive to the tourists. So next, following the well-being attributes that should be incorporated in the ASEAN tourism zoning will be the accelerating vaccination program for each country or destination, and real-time list of nationality that able to travel because of the pandemic. So suddenly they have proposed a new nationality that able to travel to that destination. So in that system should be have a real-time list of nationality. Okay. So what is the criteria level of black 1 zone? So this is for the each color zone. So the black zone will be the highest rates. So of course, all of the highest should be the COVID-19 records. Okay. So and then the vaccination status following by several healthy and safety, security and cleanliness environment. So for the next one, the red zone color should be the medium risk. So in the medium risk, every respondents agree that every criteria should be in the high risk level, especially with the COVID-19 records. And then for the third level, the yellow, the medium one, also the same, which emphasize on destination carrying capacity, means that how many tourists that can able travel to that destination. And then for the safe zone, the low risk, respondents started to focus back on the COVID-19 records, the vaccination status, and how applicable of the digital and virtual platform for the tourists, especially for virtual tourism. And then for the safest, I think all of the criteria should be in the highest safest level. And then what is the degree of risk for the following physical attributes in the ASEAN tourism zoning? So as a tourist, respondent perceive always will be the highest risk. And then for the medium risk should be the nearby cities. Means that every nearby city should be only can be accepted by medium risk only, cannot be higher than that. Okay, for the highest, for the low risk, it should be similar for each criteria. And then another thing is how degree risk of the following economic attribute in the ASEAN. So in the economic attributes, the incoming tourists also perceived as the highest rates, but for the medium rates should be the gradual removal of limitations. Means that many respondents still fear of the removal of limitation as the best solution for current to curb the pandemics. And then please indicate the degree of the risk for the following well-being. So there's a little bit similar, the tourist ignorance and tourist overcapacity. Means that once we open, we cannot, destination need to have a very specific SOP or conduct how to manage the tourist ignorance or number of tourists coming to the destinations. And then which criteria you will select for the safe tourist zoning should be the flying directly to the zoning. So this is the highest island with an airport. So basically, if you want to do the zoning, basically for the physical attribute or geographical attribute, we have to have an island with an airport. So the respondents also stated that 62.4% willing to travel beyond the zoning, means that beyond the islands, for example. But we have 31.5% that still skeptical to do that. So basically, the market currently still not confident enough to travel. So what would be the most appropriate radius of the buffer zone should be little bit contradict each other. For example, 15 kilometers, 10 kilometers, and below than 10 kilometers. So basically the range should be below than 15 kilometers. And then for the factors in order, from most important to least important, should be the COVID-19 statistic, health facility provided, safety provided, and the SOP should be the highest importance.
Sorry to interrupt, we still have around 2 minutes. Yeah,
okay, I will, this is the last one. So what is the risk that can be accepted by the destination or the tourists? So first will be the new COVID-19 statistics spike should be because currently they have new variant, or in the future we do not know is it the vaccine is possible to curb the new variant. And then next thing will be the congestions in health facilities. So basically the new incoming also create a new problems, a new increasing of the populations. So the last thing will be the high cost for health and facility expenses that need to cover by the destinations. So half of it strongly support, and then 40% support the ASEAN Tourism Zoning Initiative. So I think overall, most of respondents support the ASEAN Tourism Zoning Initiative. So I think this information help each countries in the ASEAN to give insights, new insights, how we want to create, especially in the tourism demand for the zoning purpose. Okay, I think that's all from me, Yoong. Thank you.
Thank you so much. Wonderful sessions. Thank you very much for the amazing sharing from our speaker, Dr. Nurhaliza, the presenter, Dr. Muhammad Ali, and moderator, Associate Professor, Dr. Awanku Hasana Baha. I would like to kindly request the working group members to stay on with us for any related questions that might need professional answers. Thank you for staying with us until our final topics of our morning sessions. In these sessions, I believe every one of us will get a chance to address our concern about digital data security. Yes, it is the final discussions of our long-awaited sessions on ASEAN digital security and interoperability standard. The presenter for our last session is Professor, Professional Technologist, Dr. Shochrul Abdul Razak. He is currently the Director of Research Management Center, University Technology Malaysia. He holds a PhD in Networking Security from University of Plymouth, United Kingdom, with experiences to the topic as professional technologist with Malaysia Board of Technologists. Besides, his experience also in cloud security knowledge, computer hacking forensic investigator, and research in computer security and forensic. These sessions will be moderated by Associate Professor Dr. Sangsuri Basupunggaya. Associate Professor Sangsuri is the Acting Director of College of Digital Science, Prince of Songkhla University, Thailand. She holds a PhD in Computer Science, Portland State University, origin from United States. She has professional certificate ISO IEC 29110 and ISO IEC 15504 for expert consultations, auditor, and lecturer training course. She also has professional certificate in cybersecurity foundations, professional researcher in e-health related security topic. Now, I would like to introduce you our speaker for this discussion topic, Dr. Charlie Vora-Kupipat. Dr. Charlie is the head of Information Security Research Team at National Electronics and Computer Technology Center in Thailand. He holds a PhD in Information System from University of Salford, United Kingdom. His experiences related to the topic. He is the IT consultant at King's Chulalongkorn Memorial Hospital for Information Security and Digital Transformations from 2016 until present. Besides, he is also a subcommittee and former secretary of Information Security under National Committee of Electronic Transactions from 2009 until present. Furthermore, he is also part of the Technical Working Group of Digital ID Standard for Digital Government Service Act since 2020 until present. With this, let us welcome Dr. Charlie. Dr. Charlie, the floor is yours.
Thank you. Thank you. Okay, just a moment. Okay, good morning. Thank you for introduction. After long discussion over the last few months, we come up with the proposal of digital security and interoperability standard for ASEAN. This is what I would like to present you from now on. Okay, I'm Charlie Varagunipat. I'm working for NECTEC. It is one of IT research center in Thailand. So I'm very glad today to give you to share information about what we have discussed over the last few months. Okay, because the COVID-19 pandemic hit ASEAN, it results in a lot of impacts. For example, we need to have the new normal life. For example, social distancing, or of course, digital transformation. Like this, we have to conduct the virtual conference, not traditional physical conference like the last year or two and before. So we believe that it is our new style of living and also working. I believe that many people have to work from home today and maybe and now on. We don't know when the COVID will be get rid of. Because we have to work online, maybe almost 100%. Cybersecurity is one of the most important issues that we have to take into account. That's why we have to discuss about what should go on about cybersecurity and personal privacy. Okay, to overcome the impact of COVID-19, as I mentioned you before, we conduct a pre-conference on April 24, and we conduct survey. And we believe that we have to use the mobile certificate for vaccination and not for COVID-19 status for ASEAN people. As you can see on the right-hand side, it is an example of ASEAN Smart Mobile Certificate. It is electronic form, or it might be the paper-based or paper form. You can see the right-hand side, it is QR code. So if you have QR code, the medical or the physician or anyone can use your code reader just to scan it, and the results should be displayed on the screen in 1 second. And the data that we have to collect for this certificate include the tracking data. It might be automatic or manual. Manual is manual. Manual, we have to just input the data into the mobile application. But for automatic method, maybe we just use one click, and the system can detect your status or your location using GPS or maybe Wi-Fi locator. And the next, it should be information about vaccination. In Thailand, and maybe in ASEAN countries, we need to have at least 2 or 3 doses of vaccination. And the last one is test result of COVID-19. Today, many ASEAN countries just introduced the use of rapid tests of COVID-19, and people can use self-assessment or self-testing to show that the result may be positive or negative, and the data should be stored in the mobile application for any people to check. And the form of the data should be QR code because it's a mobile application, and also it is kind of health risk assessment. Concerns of the certificate include security. Security here should include 3 components. For example, confidentiality. Confidentiality is somehow it's like secret. It means that the data should not be accessed by unauthorized person. It means that only people who have authorized should get an access. For example, the data owner, or the physician, or the officer, the government officer. The next security component is availability. Even you have a good system, but system must be available 24 hours per day and 7 days per week, and all day, all time, if I want to get an access, right? So it's this availability. And the last one is data integrity. It means that data, if you input and when you open the display, the data should be the same. The data should not be changed by virus, malware, or unauthorized person or hackers. The next one of the concern is data interoperability. Because we are not alone. The country is not alone in ASEAN region. So it is possible that we have to share the data to other countries or other people when we travel. For example, if I travel from this country to another country, I have to show the status of my vaccination to the health disease control in another country. So the way to exchange data, we should have the solution. So the data standardization or interoperability is one of the main important issues. The next one is implementation. To develop the system is not easy. We have to consider a lot of things like security, as I mentioned before, and privacy issue. So we have to think carefully about how to design, how to implement. And the last one is accountability. If an incident occurs, we have to know how to handle on timely basis, and we have to know how to take an action and respond. We need to know responsible person. This is very important. From the discussion, we gather information from 6 ASEAN countries, including Cambodia, Indonesia, Malaysia, Philippines, Thailand, and Vietnam. Each country has their own mobile application of vaccination status, as you can see from the screen. It is just a summary of the functions or the features of their mobile application. As you can see, all ASEAN countries on the screen have shown the readiness of the mobile application. Not my mobile, I mean the system for vaccination status. And the features should include QR code, zoning, mobile applications, and these mobile applications, the status should be various. For example, some countries may be under development, but some countries have already in place. But I believe that the system should not be the final version, and it should be updated. It depends on the new requirement request by official and etc. And also, the analog is the analog should never die, because even we have electronic version, we still need to have the manual version like the paper form, because we believe mobile applications still have some limitation. For example, we need hardware and software and also the internet. And some rural areas are also some unexpected situation that we cannot access to the internet. We still need to use the paper form. And also the last one is quite advanced issues. This is inbound travel application. It is for travelers who travel to our country, so we can have application to track this type of traveler. Okay, let me move on to the question from the survey. How to help those who have difficulties using or accessing such technologies. The solutions, we allow the use of paper form or main approach as I mentioned before, but we have to use along with the technology as I mentioned before. But also, not everyone can have the knowledge of the use of the system. So a family member can register for their dependent or relatives on behalf. Data security and privacy concerns. Many existing applications do not specify any clear standard in terms of data security and privacy. Of course, when we talk about security and privacy about the data, we need to assign the role of the data access. It is not surprising because not everyone can get access to all the data. Data must be protected under the confidentiality of medical records. In this case, it means that the data of vaccination should be treated as medical record. It is the same because the data is sensitive, right? Not everyone can see my data or can see my status. And then we need to follow the global standards to protect security of user information. The global standards, for example, ISO 2700001, cyber information security standards. Data interoperability and availability concerns, because each country has different database. So we have to know how to export and exchange the data among each other. The next one is local laws. The law is maybe one of the most important because law or regulation can read everything. So before exchanging the data, we have to study carefully about which kind of data could be shared. Otherwise, we may break the law. The solution, we have to understand the international standard. But the problem is today we don't have the usable standard about vaccination status because the WHO it just provide the guideline, but so far not all the countries can follow this guideline because they have different limitations among each country. Okay, this international standards I mentioned. The left-hand side is ISO/IEC 27001. It is recognized international standard about cybersecurity. It is, and the right-hand side is HIPAA. HIPAA is the law, it's the act about health data.
Dr. Charlie, you are mute now. Sorry, can you unmute yourself?
Okay, thank you. I think it might be actually because I didn't touch anything.
and also your screen. We need to.
Let me share again.
Yes.
Well.
Yes, we can see the screen now.
Okay, excellent. Okay, the next one. Initial proposed ASEAN security standards. All of this is about standard. We summarize that each country collects data on their own asset. In this case, it means that we don't share data among each other. I mean, across the country because law protection. It means that each country has to collect and store their own data and never share to other countries. QR code must be agreed because actually QR code, there are a lot of standards. So we have to make sure any countries or the immigration can read the data. Health risk assessment must be agreed, okay? To exchange the data, we have to agree the format. and the protocol and the standard of security and privacy. We need agreement or mutual recognition. Accountability of incident. We have to agree if incident happens, what should we do next? Next is the survey, and the survey includes the security standard and requirements, interoperability standard, certification, implementation, challenge. Demography. People who conduct who respond to the survey include all the countries in ASEAN, and most of them have IT background, and they are IT person. Security standards and requirements. If the application is compliant to standard like ASEAN standard or HIPAA, most of them they don't know. They don't have experience on this kind of standard. But about 30% they have they know they have good knowledge, and 88% agree that some security features must be used in the proper standard. Next, implementation of security features to authenticate user identity before using the application. 48% say yes, and 20% say no. In this case, they believe that before we can read the data, the person who get an access should authenticate themselves to show who you are. 91% agree that some security features to authenticate the user identity must be used. Okay. Most respondents agree that the application requests the permission to utilize respective features of the devices, and 82% agree that the standard must request for permission to utilize any features of the device. It means that the permission of using any features are very important and is mandatory. Interoperability standard and requirements. And half and half, they require to store the data at the centralized ASEAN server. And anyway, it is a technical question because actually there are centralized and distributed or uncentralized, and there is no consensus because 50% and 50%. And 88% accept to use QR code only. What kind of information are you willing to share? Almost everyone would like to share vaccination status, and more than half would like to share test result of COVID-19, and less than half are willing to share the previous history of positive status and history of anything related to COVID-19.
Sorry to interrupt. We still have another 3 minutes. Thank you.
Okay, thanks. Certifications. What is the method of how to identify a person at your country for mobility during COVID-19? Yes, of course, QR code, as I mentioned you before. And only 17% prefer to use biometric. And biometric data, we have to realize that it is very, very sensitive data, like fingerprint or face recognition. So very few people agree to use that. And more than half are okay to use the paper version. Yes, here, almost everyone agreed with the introduction of ASEAN or the code for data, identity verification and certification, and almost half they don't know whether their country certified company organization, risk qualification, and agree to country certified COVID-19 related to products. I mean, not only people, but also products like face masks and hand sanitizer. And almost 100% said that the countries implement zoning for COVID-19 risk assessment. This is the implementation challenge. What is the adoption rate of COVID-19 apps? Yeah, about 30% to 50%. it is the adoption rate. And people still accept to use pen and paper for manual method, and we can register on behalf relative or dependency in the same family. It is the initial proposed solution. The data to be stored, each country must store, and we need to have authentication and identification method. And we have to highlight that no data will be transferred or moved to other countries. This is very sensitive and it's law compliant. We need QR code standards, as I mentioned before. Even we use paper document, we still need to have QR code standard as well, because QR code could be stored in both paper version and mobile version. Health risk assessment must be done as well, and security standard must be agreed in terms of data format, exchange protocol, and etc.
Sorry, our time is up. We need to wrap this up in another 30 seconds.
Yeah, it is the last slide. And accountability is important, as I mentioned before. Every all of this slide I have mentioned already. It is just summary. So it is the name of responsible of this project related to COVID-19. Thank you very much.
Thank you so much, Dr. Charlie. Thank you so much. And now I would like to invite our moderator for this session, Associate Professor Dr. Sangsuri. The floor is yours.
Thank you. Yeah, I would like to thank Dr. Charlie for his presentation. Actually, Dr. Charlie presents the initial ASEAN Digital Security and Interoperability Standard proposal. He presents the result of the reviewing of existing approach of 6 ASEAN member countries, including Cambodia, Indonesia, Malaysia, Philippines, Thailand, and Vietnam. He also presented several concerns, which is very important, I think. These many concerns include the security concern, the data interoperability concern, the implementation issues, and accountabilities. However, in his presentation, he's also presented several solutions of these concerns. Finally, he concludes an initial ASEAN digital standard and interoperability standard proposal in 7 items, mainly the data storage issue. And the rest going to be the agreement among ASEAN countries members on several issues, such as the QR code standards, the health risk assessment, the security standards, the use of the certificates, extend from the human to other products and stuff like that, and the COVID risk level zoning, and also the accountabilities. So thank you very much. So now I think we're gonna open for the question from the floor. And I was informed that there is no question from the chat box. I guess that a lot of people are already tired, and this is since this is the last. I know that a lot of members of our working group also in this session. If you want to share your idea, you can share your idea. Turn on the microphone and share your idea now.
Can I have the feedback? If there is no feedback, can I give the feedback?
Yes, please go ahead,
Professor. Okay. Thank you, Professor Sangsun and Professor Dr. Charlie for a nice presentation. I'm interested in the topic of the ASEAN QR. Yeah, because we are not from technical information background. Yeah, we are really concerned about maybe how about the cost to have the ASEAN QR code. I mean that how we saw the technicality about the harmonization, yeah, of the QR. For example, in Indonesia case, we have a QR Indonesia standard, for example, and maybe there will be Malaysian standard, Vietnam standard, and others. So I mean that will need a cost to make it into one ASEAN QR code. And also the issue about the data centers, or also the issue of maybe I also interested in the topics of intellectual property rights. I mean about the IPR itself, how it will be related. Who will have the IPR itself and the data centers, and also because we are in ASEAN, so in each ASEAN member there would be a data storage and the system operation, or we should make an agreement. For example, usually for example, data center is in Singapore, for example. So we decide that all of the data will be centralized in Singapore for this QR, and also maybe about the data, about all the data, usually, that's all. Sorry if the question is rather basic, because it's I really interesting in the topic of about the ASEAN QR, because the digitalization, all of the working group, I think, talking about also digitalization. So digitalization is very important in this new normal, and how ASEAN can agree. I also will add, in the case of trade, in ASEAN, maybe about in ASEAN Economic Community, for example, there is the experience on the harmonization from the national single window. So there are the ASEAN single window at the time to harmonize the trade between ASEAN countries. Now, maybe it could be our lesson learned. At that time, the technology is not fast as current. Maybe that's the experience from the last story in ASEAN about the harmonization in technology issue. Thank you.
Thank you, Dr. Teresa. Let me paraphrase the number of questions that I got here. The first one is you concerned about the actual implementation and the cost of the QR code that we're gonna have. You know what? You asked the right person, because actually Dr. Charlie, he's helping with the Thai system on the certificate and all this stuff. He's the right man to answer this question. And the next one gonna be the data center, right? Where could be located and how we gonna work on that, and then the property rights like ITP of these assets and stuff like that, and you also suggest about the experience in the trading that have in among our ASEAN country. So I will ask let Dr. Charlie answer the first one first about the QR code. Please, Dr. Charlie.
Okay. Actually, the term QR code standardization, I think we don't mean that all ASEAN countries must have the standard of QR code. I mean that each country they can develop their own QR code, because I believe some ASEAN countries have their own health electronic certificate, like. So they have implemented for a long time. So I think we don't want each country to change everything for data exchange. They just use their own existing standard. But when we try to exchange the data across the country, we need to just give the way or the solution for the other country to how to read this QR code. For example, just public key. We just provide public key to the destination or to another country. And this public key can help to understand that this data is real, is not hacked or changed by unauthorized person. It is what I mean, because today QR code, any QR code reader can read. But the standardization, I mean that we have to develop the way that each country can trust the data or the QR code of among each country. And the cost is quite low, because QR code generator is free.
Thank you, Dr. Charlie. So basically what you suggest is that It's very low cost. Dr. Telisa, right? It's very low cost because we all have a QR code. As you can see, Dr. Charlie already presented a lot of countries use a QR code. We just need a way and the understanding on how to read it. I have to be able to read Indonesian QR code. You have to be able to read Malaysian QR code. So how to do that? There is a technical term that Dr. Charlie mentioned. It's called public key. That's how we use it in the web base and stuff like that. When you said you encrypt in the web base, they use that stuff. And the thing is, this public key, you can download it openly, and you are make sure that this is from Thai government, and then you can read it. So that's a solution. So I move on to the next question about the data center. This is interesting, Dr. Charlie. Dr. Telisa asked, so what about the data center? Like she said that we all keep it in Singapore. Why don't we just put it in Singapore? What do you think? Yeah.
I'm not sure if I understand clearly, but I believe the data center should be in their own country. That's all, because this is very, very sensitive data. Yet we should treat these vaccination status data like any general medical record. The data should be in maybe in hospital, in Ministry of Public Health, or in the National Data Center. That's it.
Yeah, thank you. Actually, Dr. Telisa, this point I do agree with Dr. Shari a lot, because we have to treat this information. Let's think about this. You think the bank record and all those stuff about the financial and about the personal thing of each country, you're not going to move outside of that country for sure. But the data can be shared in the way that you are sure that this is the authentic data, right? And data is not being change during the transmission. So if you are sure that these two can be trusted, then you are sure the data can be anywhere, right? So for example, my data has to be in Thailand, but if I travel to Indonesia, you should be able to ask to see some of the data that we are agree upon to provide it to you by our data center. So basically, that's the idea. Now, talking about intellectual property, if you do the way that Dr. Charlie and I just discussed, the intellectual property will not be an issue because the data reside on their own country. But the way to exchange it, we use the standard. Just like Dr. Charlie presented before, we have ISO that govern this stuff. We have a HIPAA, for example, that try to protect the medical record. So actually, if we use all those national standards, some of these will be answered. I mean, in the standard and in the standardized way. Okay, so for the last one about the question about the trading information, to tell you this, I have no idea about that yet. What it does. So I'm not sure if Dr. Charlie has any information on that, because Dr. Telisa said the trading has harmonized stuff that they can exchange the data and stuff like that. That's new to me. Yeah. Maybe Dr. Charlie or Dr. Telisa can give more information.
Yeah. Can you please give me a little bit more information about
No, it is just a suggestion that maybe there are something lesson learned for us in doing harmonization in technology that already we have in the story of ASEAN. We already have the ASEAN harmonization for the single window in ASEAN. It's just a suggestion, not maybe for the further discussion. Thank you.
Thank you.
Thank you, Dr. Telisa. Yeah. Any other question from the floor? Any suggestion from our working group? I saw Professor Suko. You want to join in the discussion? Professor, hello.
Yes, Prof. Thank you very much. I think Prof. Charlie already answered quite well on concerns brought by the participants. But later on, I will share, according to today's survey, it's very interesting finding because most of the participants in the session today and yesterday agree that the data should be centralized. So it's quite interesting finding. So, but later I will share on the detail of the finding. Yeah.
Thank you, Professor Suko. Yeah, I know it's fun actually. A lot of people think, and when the technical guy talk, it's always into different way. But I think we always find the middle way that we can agree upon. I think because actually it's just a proposal, right? The representative of the government of all the country has to agree. So all those gonna be, I think, another phase of this work actually. Yeah. Thank you. Yeah. Any other question from the floor? Because
hello, Doctor, Professor.
Yes,
very interesting topic that been discussed for this. I've been waiting for these last sessions of panel discussions to wrap up. Actually, this session will be the wrap up sessions from the webinar 1 until webinar 4, and then finally we can come up with one general solutions and one word for the ASEAN working group members. So I would like to share and probably would like to raise questions as well. If everyone could possibly recall back from my presentation just now on the tourism zoning, digital tourism zoning indicator and parameters. What's your response, or what do you take, Dr. Charlie and Professor and all the panels here, in terms of in similarity of the data, and as well as how the guidelines from in terms of the data security, in terms of the data similarity, in terms of the different capacity from one country to another countries, that probably we can say that okay, this is probably what ASEAN can be looking forward into the context of the data itself, and the moving forward to each of the sectors can be can buy into that particular matter. Thank you.
Thank you, Dr. Halisa. I think the first question is that how possible that we can do, because we saw that all the existing approach of each country, right? How we can think that we can move forward from this, if I get the answer, the question correctly. So I will first ask Dr. Charlie first to give an idea that what do you think, since we saw a lot of country and you also involved highly in the Thai government on doing all this stuff, and then I will go to the Dr. Suko next. Okay? Yeah, Dr. Charlie, please.
Actually, there is not a single solution, but in my opinion, I believe we need to focus on the domestic use first, because we have to protect people in each country, in our country first. And for example, we have to have the consensus from the government officers that which kind of data we need to collect. I mean, for domestic use first. I mean, only domestic, not international. Once we have consensus, we have another step to ask the agreement from the official as well, that which kind of data we allow to be appear in the international vaccination passport, something like that. So there are two steps. And the next step, the final step, is that we show this kind of data. And it is only the data we can share to you. So we ask each country, do you agree or not? Because we cannot share more than this, because it might break the law. This is what we experienced so far. And even so far, we don't have consensus from our official yet. Because I'm an IT person, I'm not a medical person.
Okay, thank you, Dr. Charlie. So how about Professor Suko? Your opinion on this, please?
Thank you. I think a very, very valid question. What we have these days, of course, we agree that we have different systems from different countries. Malaysia do have our own platform, so as Indonesia, Philippines, Vietnam, and so on. But what we need is to somehow what we call a middleware, which actually leverage all the differences. But what we're trying to do here is that even though we're proposing a middleware to somehow standardize all those different systems, but we need to adopt to a standard or security standard that actually already been used by international. That's why we propose security standards, international level security standard that can leverage all the differences practiced in different countries. That's number one. Number two, in terms of data centralization or data decentralization, it is up to how we agree on the sensitivity of the data that we collected. We need to see what are the minimum data that we have to collect in order to facilitate this initiative. Once we agree on the data that we need to collect, then we need to see what are the standards that need to be put in order to protect those data. So it's still an ongoing things to be done, but we believe that above all, we need to refer to international standards so that we could leverage all the differences between countries. Thank you.
Thank you very much. And I have a question suggest from the committee here. Actually, since Professor Suko and both Dr. Charlie said that we need someone from the health, so maybe the representative from group 1 can help me answer. And I got the name here, so I have 3 questions. Group 1, actually, for group 1, which health data is allowed to be shared, which one is not? This is the question, and probably representative from group 1 can answer this for me. Professor Rafee or Professor Augustine, are you in the room? The committee point me to you too. That can help me answer this question. Or otherwise, any others representative of group 1. The question is which health data is allowed to be shared, which one is not? And the next question, probably group number 2 can help me answer this. Any limitation from tourism data which is not allowed to be shared? Okay, and for group 3 is any limitation from tourism data which is not allowed to be shared. So basically, a lot of people are concerned about this. Which one, in your expert opinion, that can be shared or cannot? Maybe Professor Telisa and Professor Telisa can help me on this too for the discussion, please.
Okay, I think I can respond on my part, which is yes. Which tourist data can be shared and which one cannot be shared. Yeah, normally in tourism we are quite open. we are quite open anyway. Yes. We like to share everything, you know. Yes. In tourism trend currently. When we go travel anywhere, the first activity that we going to do is selfie ourselves and then put it into our platform, Instagram, social media platform. So that's how open the tourists can be. So everything, wherever you go, whatever that you do, you will share to everyone. So from my point of view, tourism industry, it's not concerns on the safety security. However, when it comes to the interpersonal situation, so it's up to the one person to another person. So on how much the experience that you want to share to everyone. So when we're talking about the tourist experience, we're talking about the activities that you share with everyone else. So sometimes you are faking, you are not doing the right thing, right? Sometimes the food is not that tasty, but you make it like you are very enjoying the food when you go to the tourism destination. So that's how the tourism industry looks like, and what's not to be shared is how the experience, the sad experience, the bad experience you be in the destination. Normally, the tourists were not that open in sharing that kind of information. Like, for example, you experience theft at the place, you experience being robbed at the places. So normally that kind of thing is not being shared openly, but probably, but nowadays still can be shared as well. Just to point fingers to the operator. The place is dirty. The place is not clean. The place is not safe. That kind of things. Yeah, that's my opinion.
Okay. Yeah. Thank you. So I saw Dr. Telisa open the. Yes. Please go ahead. Thank you.
Thank you, Professor Sangsuri, for the opportunity to join this discussion about the data. Yeah, I'm from the industry sector and economy, and what is the data that cannot be shared usually? Yeah, usually first related with the national security. I think the sector that related with national security should be more protected. I mean that, for example, that maybe related with the national resilience. Yeah, yes, from strategic national, I think still need to be protected. Yeah, and then talking about the individual transaction economic data. For the aggregate data, I think it's still okay. Yeah? But for the individual economic transaction, for example, it is also need the security. Usually it is related also with the issue of taxation usually. Yeah. If we talk about taxation in economy, sometimes the data is also becomes the problem. So if we talk about the small medium enterprises, maybe for the it is not really problem with the big company or with the medium company, but the problem should be on the micro and middle, micro and small enterprises. Usually there are many problems with them that they are very, very vulnerable. So I think that should be also protected, in terms of the data. I mean that sometimes the information about the onset, the information about the asset is sometimes very, very restrictive. I mean that it is related with the business competition. I mean that some things that related with business competition, it should be still keep. Even Dr. Aziza said that currently when we going anywhere with the handphone, they are know about our behavior. Sometimes we get the advertising related with our hobbies. We never thought this handphone about my preference, but they can do the artificial intelligence. They know what I want. The product usually has been currently in the digital technology, everything should be in the handphone. Our smartphone can know our preferences of product, for example, but still I think for the national security, for the vulnerable groups, and also for the privacy in terms of business related with business competition, it should be not shared. There is some that can be shared in general in aggregate view, but in individual, more on the, for example, the receipt. If we talking about food and culinary sector, there are some secret receipt. It cannot be shared, of course, because it's like like the competitive of the one business. So it cannot be shared, but for general things related with business, maybe it can still share. Thank you.
Thank you, Dr. Telisa. I actually from the conclusion, from the conclusion from both Dr. Halisa and Dr. Telisa, it sounds like a lot of things that concerning like something that in the business and national security and sometimes personal too. So it lead me to like something like personal protection, personal data protection, which is the law in many countries, the information security of some country that we have. So basically, all those we have to be careful if we want to share the data. So that's from the discussion that you have, right? Dr. Charlie or Professor Suko, you have any others comment on this you want to add on? We still have time, and I think I have one more question from the chat box right here. Yeah.
I think Prof, it's coming back to what are the information we want to share. You know, when we talk about medical information, there are so many medical information. Are we talking about information if we leak information is going to, harm the person in terms of emotionally or physically? But when we share COVID-19 related information, what kind of information that we share? If we're sharing about vaccination status, positivity status, maybe there is not as much as worrying compared to if you're talking about people having HIV or any, disease, that could actually having bad reputation. So it depends on what kind of information that we share actually. Yeah. I
do agree because the funny thing in my hometown actually, we have a foreigners that be a worker, right? And at the first phase, that foreigner has a lot of COVID disease infected. So it's a social that harm them because they cannot buy anything, they cannot go anywhere, and people don't want to get near them. So sometimes when we talk about something that can harm people, in different society, in different country, maybe it's different. So I think this is very sensitive thing. This happened in my hometown actually, and it's very funny. Like they cannot go to the market, people just don't want to get near them, and that's really, really, really sad actually. Yeah. Okay, Dr. Charlie, do you want to add something? Yes.
Not only cybersecurity, but also we need to concern about functionality and ease of use. Because if we have too much security, it may block or inhibit the use of vaccine certificate system. For example, if I'm a traveler and if I arrive to the destination, and if my QR code has a lot of authentication system or authentication steps, for example, they have to input some information to input some login password, it may waste the time and it may result in a long queue in the immigration. So it is not practical at all. And also, if each country have to adopt application for vaccination status or etc. or similar application, they need to adopt only one single application. Less system, that is better. It's better. We should not have something like silos or each officials or each ministry would like to develop many different applications, but they have the same objective. It is not good.
Sorry, the time is out. Thank you.
Oh, okay. Thank you very much, moderator. So I would like to thank everyone that joined in the discussion, especially Dr. Teresa, Dr. Harisa, and now I will give the floor to Professor Shochrul. Yes, thank you.
Thank you.
Okay, so for the last session, I'm going to share yesterday and today's results on online survey of ASEAN digital security and interoperability standard. So let me share my screen first. Okay, quickly, I know everyone is going to lunch, but just quickly on the result. So the study was purposely to seek feedbacks and opinions regarding what should we have to be adopted in our proposed ITTP-COVID19 digital security and interoperability standard. So the respondents, around 170 respondents from yesterday and today, from all countries in ASEAN. So in terms of security requirements, we asked the following questions about the compliance to security standard, about compliance to data confidentiality and data protection, about the implementation of security mechanism to authenticate as well to protect data in transit and data at rest, and also about the application, whether it should request our permission before the application utilizing our devices for camera or for location services, etc. And from the results, we found that more than 90% of us, of the respondents, agree that those compliances and requirements must be there, must be the features of the COVID-19 related app. So it has to be considered as one of the features in our proposed for ASEAN initiative. In terms of feedback for interoperability standard requirements, we asked the following questions: whether if the ITTP COVID-19 digital proposal require our data to be stored centrally in ASEAN server. Would you agree? And this is what I mentioned just now. From our previous survey, it seemed 50-50 divided opinion, but from yesterday and today's participants, most of participants actually agree to have one data center at ASEAN level for this initiative. And if they agree, what kind of information they are willing to share? They are willing to share on vaccination status and also on COVID-19 test results. But divided opinions on about the previous history of positive status and also about the another health history related to COVID-19. In terms of if they do not agree, what if we only have QR code solution, which will be connected to each country own database for data exchange. So most of the respondents also agree on this initiative, only QR code implementation. In terms of feedback on certification, what are the methods to certify or ratify a person at our own country for mobility during COVID-19 pandemic? So most of us responded that we utilize QR code in our own country, but interestingly, some of the countries also utilize biometric recognition. And not a surprise, some countries still relying on paper-based or manual due to technology issues. In terms of do we agree that we do if we have one QR code for data identity or verification certification for all ASEAN for mobility purposes? Yes, we do agree. 90% over agree on this QR code for ASEAN mobility. In terms of another certification, so apart from certify a person for health risk, what about health risk certification for companies or organizations? So we do ask this question, and a lot of respondents mentioned that in their country, they do have this kind of certification for company organization to certify that they actually comply for SOP for COVID-19 and such. Not just company organization, we also ask whether the country also certify product or services. And 70% of the respondents mentioned that in their country, their country also certify product services that comply to COVID-19. Zoning, this might be interested for the tourist group, tourist focus group. So all countries actually having zoning for COVID-19 risk assessment, which is good for our initiative. In terms of challenges, we found that the take-up rate, the adoption rate of this technology is still around 50% adoption from all the countries. Many parts of the Asian countries are still relying on paper-based, non-technical solutions. And to handle these issues, most of us mentioned that we use manual or paper-based recording using pen and paper. And some of the countries also already implement dependency options in the technology, so that family members can actually be represented by a family head, for instance. So in summary, most of the respondents agree that application for the COVID-19 at ASEAN level for mobility purposes must adopt to international standards to ease the process and to neutralize the different requirements from various countries. Number two, most of the respondents also agree that we could have implementation of centralized server for data storage. Majority of respondents also agree on the usage of QR code for easier usage and integration. But of course, with no data stored on centralized server. Alternative mechanism must be in place to address portion of population having difficulties in accessing technology for paper-based or non-IT literate. Certification also might not be limited to people. We could also certify businesses and products and services. And last but not least, most of the countries already implemented zoning initiative for COVID-19 risk level assessment. However, those different zoning mechanisms need to be unified in order for us to facilitate the integration process and in the interoperability requirement for this ASEAN COVID-19 initiative. So those are the findings from the survey that we have conducted for yesterday and today. Prof, thank you.
Thank you so much. A deep thank you for our last speaker, Dr. Charlie, the last presenter, Prof. Dr. Shochrul, and also our last moderator, Associate Professor, Dr. Sanjay. Thank you very much. Ladies and gentlemen, after the 4 deep insight discussions, I'm sure a concise summary will be a boost to your memories about what have been discussed today. Our moderator from each topic will be given 1 to 2 minutes to wrap up and strengthen the outcomes of the final discussion just now. Now, let's begin with our moderator, Professor Sanjay, from our first topic, ASEAN Smart Mobile Certificates. Professor Sanjay, the floor is yours. Sorry, Professor, we can't hear your voice yet.
Can you hear me now?
Yes, I can hear you now. Thank you.
Apologies. So thank you very much. In 1 to 2 minutes, I will summarize a lot of discussion that we had. Actually, the first session was very good. We had a presentation by Dr. Aulia, which was very good. He gave an introduction into an overview of COVID-19. He stressed the importance of resuming international travel. And then he basically presented a scoping review, which set the stage then for a very active discussion by everyone. We had very good input from our working group and from members who attended the session. And we also had many questions coming up from everyone. So basically, the three main objectives of the working group is to propose the development of SOP, to secure interoperable systems with ASEAN country members, and lastly, to enable ASEAN cross-country traveling activities for business, residents, second home, tourism, and education with control, while controlling the risk for COVID-19. And I think after that very active discussion, Prof. Rafee then presented to us a summary of the survey results that we had gotten from a couple of hundred respondents. That is the gist of the first working group, the session for the first working group on the ASEAN Smart Mobile Certificate. And I think to end it, I would say that there was a lot of good comments that came out, and I think the working group will take this into account and will continue working on the Smart Mobile Certificate. Thank you.
Thank you so much, Professor Sanjay. Now, I would like to invite our speaker from the second topic, Dr. Telisa, to give a summary on ASEAN SME internationalization's policy in new era in 1 to 2 minutes. Dr. Telisa, the floor is yours.
Yeah, okay. Thank you very much. Because I share my screen for this conclusion, Mr. Yoong.
Yes, please.
Okay. Okay. This is thank you very much for the input from all participants and very nice discussion, and also thank you very much for the committee that arranged this. So we can we can have some important things that we try to formulate. The first is to ensure the supply chain connectivity, particularly of essential goods and services in ASEAN could need it. For example, need the health or vaccine certificate and trade measure harmonization as the part of the quality standard in SME policy index. And we can conclude that there are important of four nexus so consider in ASEAN economic recovery after pandemic. It's trade, health, tourism, and technology. So it's I think all working group can be collaborate, and we also can highlight it, the importance of health, safety, and environment as the input to SME business model. So this is also needs the further discussion and how to adjust the regulation in ASEAN about this. And also ASEAN need collaborate in SME capacity building in adapting digitalization, and discuss further about policy in facing e-commerce and financial technology development. And also to support the role of the private sectors and other stakeholders, including higher education or university, maybe to recovery the confidence in the market, promoting new business models like the diversification and digitalization and the opportunities, and also facilitate the post-pandemic recovery policy. So the final notes that we can learn different aspects of different countries and exchange the new innovative ideas of the better improvement. Yeah, that's all for us, and thank you for all participants for the input and very nice discussion. We hope that this could be useful for the ASEAN next policy recovery recovery from pandemic. Thank you very much.
Thank you so much, Dr. Telisa. And now let us hear the summary from our moderator, Associate Professor Dr. Awanku Hasana Baha, from the third topic, ASEAN Tourism Digital Zoning Guidelines for Smart Traveling Network. Dr. Awanku, the floor is yours.
All right, thank you very much, MC. So we are doing on the ASEAN Tourism Digital Turning Guide for Smart Travel Network. Well, one of the things that we want to conclude basically is after presenting the framework that we had, and I think the process actually has been long. I think we have done a lot of survey on opinions and things like that. And one of the things that the challenges that we're going to have in terms of making this into more of a practical approach would be the dynamics of a situation, dynamics of the the pandemic itself. Because I think one of the challenges in doing anything like this is really on how would you be able to predict if there's something changes and things like that. And what the 7 parameters that has been actually developed with the weightage that there has been indexed through the survey, I think that was actually quite solid and quite interesting. And obviously that this is something that we believe that is going to help to the road of recovery for the pandemic era, especially in the tourism industry. But then again, even before COVID-19, if you're a tourism scholar, then you would know that tourism is always a fashionable thing. It's a fashion. It's always changing. It's a trend. So like this also, we don't have to forget that it's going to be a lot of changes as well. So doing something like to the core of it that can actually withstand the changes and trends and fashion and things like that would be very useful. So this is what we get from our moderations or our discussion and our presentation today. Thank you very much.
Thank you so much, Associate Professor Dr. Wangku Hasana Bahar. And lastly, I would like to invite our moderator, Associate Professor Dr. Sangsuri, from our last topic, ASEAN Digital Security and Interoperability Standard. Dr. Sangsuri, the floor is yours.
Thank you. Actually, in the last session here, we have Dr. Shali to present the result of our working group in proposing the initial ASEAN digital security and interoperability standard proposal. We have 7 items at the end, and we also have a very interactive discussion actually concerning many topics such as the QR code, the data center, and the concern on the data to be shared, that allowed to be shared or not shared from many fields such as the tourism field, from industrial field, and from IT fields, right? And at the end, Professor Suko presents the result of the survey that conducted during the 2 days of a conference on the concern that we have. I think that the result from the survey and the discussion today will be a good start for the next phase. Because I'm from my IT background, there are several techniques in IT that can solve the issue. I think we have it. It's just that we need the agreement and the policy to be laid out first, so that the solution can come up later, especially the agreement among ASEAN country members on several important issues. For example, the QR code, how to use it, the health list assessment, what we're gonna have, the data to be shared, the security standard that they accept, the use of the certificate, okay, and the risk level zone, and also the last one that I think we need to think about it is the accountability. If you want to share this, what if incident happen? What gonna be the accountability? What gonna be done? What is the policy? So that will be all from my side. Thank you very much.
Thank you so much, Associate Professor Dr. Sangsuri. Thank you for the full summary and conclusions. It is extremely beneficial to have such significant insight input from all of the honorable speakers, moderators, and presenters. Before we end our sessions, I would like to request a group photo sessions with our speakers. Audiences, please switch on your cameras. There's 6 pages. Now I will say ready, 1, 2, 3 for the first page. 1, 2, 3. Second page, 1, 2, 3. Third page, 1, 2, 3. Fourth page, 1, 2, 3. The fifth page, 1, 2, 3. And the last one, 1, 2, 3. Ladies and gentlemen, that's all of our agenda for this morning sessions. Before I close the sessions, we would like to inform you to reach us through our website by scanning the QR code provided on our screen. With that, it's been a pleasure. I'm Yoong, resigning as your MC today. Thank you very much, ladies and gentlemen. Goodbye.
Thank you.
Thank you.
Yeah.
Everyone. Have a good day.